All right, welcome back, everyone. Kim, thank you for the presentation, and I really want to commend Child Welfare Services, not just the 88 recommendations, which has been a work in progress for a few years now, but really the transformation in thinking around investing in prevention, the work that's been done across all of the different lanes to tackle issues of the disparities that we saw and a lot of the inequities that we saw and disproportionality. And so I just think what child welfare has gone through in the last few years, dealing with the pandemic, everything associated with that, the investments that we've made, the way we've integrated that, the embrace of the training, I just think has us in such a fundamentally stronger position today than we were a few years back. And so no real questions or comments, just a general acknowledgement of a lot of really focused work to really get our department in a great spot. So kudos to you and your team for that.
Thank you, Chair.
Not seeing any other supervisors, let's go to our next department.
Thank you, Chair. Kim Gallo, Director for Aging Independent Services, is next.
Good afternoon. Aging and Independent Services, known as AIS, is part of the County of San Diego Health and Human Services Agency. AIS improves the quality of life, advances equity, and fosters dignity for over 66,000 older adults and persons with disabilities locally by providing information and essential services for health, safety, and independence. We are dedicated to opening the door of opportunity and independence for seniors and persons living with disabilities. Aging and Independent Services is a critical part of the safety net for older adults, and we have accomplished a lot over the past year to ensure the health and safety of residents. Our in-home supportive services program consistently exceeds the state's performance expectations for initial eligibility assessments, with 90% completed within 45 days and nearly 100% of annual reassessments completed within 45 days. State expectations for initial eligibility is 80% completion in 90 days, so we far exceed this number. We served more than 2 million meals through our nutrition programs and reached a variety of vulnerable populations through outreach and services to help address food insecurity and social isolation among our senior nutrition clients and others in the community. Adult Protective Services staff conducted 97% of face-to-face contacts within 10 days of receiving an Adult Protective Services referral to provide timely assistance and resources that help meet identified needs. We achieved goals across all aging roadmap focus areas, including an enhanced focus on the principles of equity, which are included across all 10 aging roadmap priority areas. In addition, the public conservator staff conducted 98% of investigations for temporary conservatorship within 10 business days. Public administrator and public guardian staff filed 100% of public administrator, public guardian accountings concerning all estate assets and liabilities with the probate court within 90 days of established guidelines, which provided information necessary for proper oversight of conservatorship and decedent affairs. We are proud of our staff's commitment to timeliness and excellence in serving the public. By 2030, the number of seniors aged 55 and older in San Diego County is expected to increase to over 1.1 million. The fastest growing age group, those aged 85 and older, is projected to increase an estimated 73,000 in 2020 to nearly 90,000 in 2030. The Aging Roadmap represents the County of San Diego's comprehensive system of care, including person-centered and community-wide efforts. AIS provides a wide variety of services that carry out the goals and objectives established in our county's local Aging Roadmap and align with the county's strategic plan. One of our departmental objectives in the equity area is to reduce disparities and disproportionality and ensure access for all through a fully optimized health and social services delivery system and upstream strategies. We are expanding culturally relevant and accessible services to older adults, people with disabilities, caregivers, and families. Staff continuously take trainings that focus on equipping them with knowledge and tools necessary to communicate appropriately and respectfully with older adults and persons with disabilities. AIS reviews programs for improvement, such as access to technology, contact with volunteers and long-term care residents, partnership opportunities. For example, San Diego Lesbian, Bisexual, and Transgender Community Center, and development and translation of documents for individuals with access and functional needs. Aging and Independent Services programs continue to include diversity and inclusion in unit meetings. Our staff share resources, links, videos, and conduct activities to increase awareness and promote cultural competency and inclusivity internally and externally. Aging and Independent Services is maximizing the number of staff who are evaluated for bilingual proficiency to ensure inclusive and responsive service and a no wrong door approach. AIS program support is removing all gendered language from new and updated AIS issued policies and procedures. In the area of sustainability, Aging and Independent Services encourages supporting environmental community change to enhance healthy living for older adults and reduce their vehicle miles traveled by supporting walking groups, active transportation initiatives, safer intersections, and sidewalks conducive to wheelchairs and walkers. In the area of community, as always, one of our core values is to remain connected to our community regardless of the barriers we have to overcome. While continuing to serve our community safely, AIS staff hosts virtual and new programming to keep older adults connected. Aging and Independent Services community engagement also includes coordination of 12 community committees that work on goals around health, fall prevention, caregiver support, educating the community on resources, housing, transportation, social participation, and dementia. Through these committees, staff and community members create resources, conduct events, and develop new programs. Input and feedback on existing services is collected via these committees. In the area of safety, a fundamental objective of many AIS programs is to ensure older adults and persons with disabilities are safe in their own homes and community. AIS is seeing a consistent growth in its customer base. We know the older adult population is growing rapidly, but we are also seeing expanded eligibility for our existing programs and services, as well as being asked to develop and support new programs. Building upon the success of the Home Safe program, Aging and Independent Services is partnering with the Office of Homeless Solutions to focus on providing targeted resources to an expanded demographic of vulnerable older and disabled adults who are homeless or at risk of becoming homeless. Our call center has seen a steady increase in call volume as adult protective services and in-home support services calls are trending higher and expected to continue increasing. The Adult Protective Services Program has expanded and is now providing services to older adults 60 to 64 years of age, when previously it was 65 years and above. And the public administrator, public guardian, conservator is committed to addressing homelessness as it interfaces with conservatives and enhancing collaborations with the City of San Diego, local hospitals, and community partners to address homelessness, and continuing to enhance their partnership with behavioral health services to provide the best services to our clients. Here are some of our key in-home support services: senior nutrition program, adult protective services, and public administrator, public guardian performance measures. We consistently meet or exceed state performance expectations per program such as IHSS and show a high level of performance across all of our programs and goal areas. Our total proposed budget for fiscal year 22-23 is $234 million and includes 613 positions. While the overall budget shows a decrease of $14.2 million, that is driven by completion of one-time costs associated with the COVID-19 response efforts to deliver meals to older adults at risk through the Great Plates Delivered program. Absent the Great Plates adjustment, our budget is up by almost $31 million. There is also an increase of 121 new positions proposed, primarily in in-home support services and adult protective services program to meet continued growth in our caseloads and referrals, to continue to enable individuals to remain safely in their own home and to support increased overall safety for vulnerable adults. And on the last row, you will see that 13 of these positions are in the public administrator, guardian, conservator programs to address growth in referrals, but also to address increasing case complexity, law changes, and community collaboration to deliver person-centered services. And here is a slide for our main areas of budget changes. Although there is the adjustment to align with the end of Great Plates near the bottom in red, that might have been on the previous slide, you will see near the top that there are additional increases for food and nutrition services for seniors and older adults at risk. These programs include funding through the Older Americans Act and under the American Rescue Plan Act, as well as continued food and nutrition services funded through the county's direct allocation of ARPA funds for older adults at risk in communities disproportionately impacted by the pandemic. We also continue to meet the county's annual 4% in-home supportive services maintenance of effort increase with additional realignment funds for the county's share of program costs, and are reflecting increased costs for in-home supportive services provider health benefit contributions, which increase as paid in-home support services hours increase. The IHSS program increases also include more staffing in the in-home supportive services public authority program to match provider resources with increasing caseload, as well as supporting priority areas for robust and increased recruitment of in-home support services caregivers. And lastly, I want to highlight an increase of $3.5 million for the Adult Protective Services Home Safe program, one of the new areas of expansion referenced earlier in the presentation, which we are excited to augment with additional housing navigation and stabilization services for those that are homeless or at risk of becoming homeless. Aging and Independent Services program services and practices align closely with the county's strategic plan. AIS is developing a garden for kinship families to provide a sustainable opportunity for families to enjoy and interact with their natural environment and have access to fresh fruits and vegetables. This aligns with the department's sustainability objective to cultivate a natural environment for residents, visitors, and future generations to enjoy. We also are supporting environmental community change to enhance healthy living for older adults and reduce their vehicle miles traveled by supporting walking groups, transportation, safer intersections, and again, sidewalks for wheelchairs and walkers. Aligning with the Equity Strategy Initiative to reduce disparities and disproportionality and ensure access for all through a fully optimized health and social services delivery system and upstream strategies, we provide at a minimum 1 million meals to older adults through our senior nutrition program. This includes meals served to older adults through a variety of ways, including home-delivered, congregate dining, to-go, and also addresses food insecurity and social isolation. Additionally, we complete 90% of initial eligibility determinations for home-based caregiver services through in-home supportive services within 45 days so individuals can stay in their homes. We also ensure 97% of our annual reassessments for IHSS are completed within the 45 days so that they can also stay in their home. We continue to invest in our workforce and operations by providing support services and excellent customer service to ensure continuity of operations remain at its best. The Aging and Independent Services Call Center goal, which performs centralized intake for various programs, is to answer the majority of calls in under 5 minutes. We also provide programs and services that enhance the community through increasing the well-being of our residents and our environment. The Long-Term Care Ombudsman Program aims to visit 100% of skilled nursing facilities which provide medical care quarterly. We also visit 90% of residential care facilities for the elderly, which do not provide medical care quarterly by the Long-Term Ombudsman Program, per our federal guidance to strengthen protection for vulnerable older adults and persons with disabilities. In the area of justice, we want to ensure a fair and equitable justice system in the defense and prosecution of crimes, investigation of abuse and neglect, and support services. For victims, Adult Protective Services conducts 97% of face-to-face Adult Protective Services contacts promptly to ensure assistance and resources that help adults meet their own needs. We also complete 98% of initial assessments for grave disability within 10 business days at the Public Conservator's Office. Subject to any questions, this concludes my presentation.
Thank you. Thank you, Kim. Thank you for all the work. Obviously, during COVID, we put so much focus on protecting seniors and helping seniors. And I think that spirit that we came together to protect the most vulnerable certainly has to continue into the future. And when you look at the list of accomplishments, and I won't reiterate them all, but whether it's 1 million meals or 97% connection, I mean, it's clear how many lives we're touching. And I think given the demographic trends and what's happening, we know this is going to be an area of increased attention as we move forward, not decreased attention. And so really appreciate all the work your team does. Not seeing, Vice Chair Vargas.
I'm going to ask everybody. I'm going to come back to you. I'm just kidding. I apologize. I know you're doing great things on equity, so I apologize. I had to go run to a business. This week is Small Business Administration Week, and I had to go do a presentation, so I apologize. But anyway, thank you for all the work that you're doing around aging, particularly around District 1. We have, our numbers are increasing in that district in particular, so the work and the partnership with our communities is really important. I'm particularly interested around IHSS program and how many people do we have currently enrolled in the in-home service supporters?
We have approximately 34,000, and we have about 4,000 children that are in that program as well.
Okay, and the increase in the 60 positions is going to be sufficient for what you're trying to accomplish?
Yeah, we are trying to keep up with the caseload growth, and we've experienced about 5% per year of caseload growth. So we're hopeful that this will help alleviate some of that and get to a great level where we can continue to serve and meet our deadlines.
All right. Just wanted to check on that because I know that there's, I don't know if there's a backlog or where we're at with that, but I know that there's.
Yeah, we're actually pretty caught up on in-home support, and that we have had a large increase to our call center. That is primarily where we know that word is out, because we've had about 80,000 calls this year compared to last fiscal year where we had about 67,000 calls. Yeah. So we see year after year just a large growth in information and referrals for any of our programs.
Well, thank you. And then the magical question, the equity tool.
Absolutely. And I will tell you, our budget today aligns with the budget equity tool and our AIS mission, which is to advance the equity for impacted communities that we serve. One of the things is many of our programs are federal and state directed, and so with that, we have to adhere to the population specified by the policies for those programs, but for everything else, we did use the tool this year, and I think we learned a lot through that process, and we are hopeful to make it even more user-friendly for next year. I think one of the things, the community input piece, we luckily we survey our committees and we have a lot of input on a regular basis, and so I feel that we could do a little more of that for next year as the community input. But I think all in all it was very useful to help us identify those gaps and where we could be emphasizing services.
And on the community input, do you also, I'm assuming, include the stakeholders that you work with, like the nonprofits?
Yes.
And all that? So I'm
yeah.
Okay.
And one of the things with AIS is we have to do an area plan every 4 years, so we do a lot of community input as part of that as well. So we are constantly surveying our stakeholders, whether it's our budget partners or our seniors in the community.
Appreciate the great work. Thank you.
Thanks.
All right. Thank you very, very much.
Thanks.
Let's go to our next presentation. Oh, Supervisor Wasserman.
Sorry about that. Yeah, I just had a question about the staffing and wondering if you are facing any challenges with staffing.
With hiring or
With hiring or retention, yeah.
I think we do pretty well at AIS. We actually have about a 1% vacancy rate, which
With the
pretty low.
IHSS program.
With IHSS, we're fairly staffed, and then with these new positions coming on board, we are really working closely with our HR partners to bring those people on as quickly as we can, pending, approval of the positions. Thank you. Yep.
Thank you.
Next up is David Estrella, our Director for our Housing and Community Development Services. David?
Good afternoon. Housing and Community Development Services provide safe and affordable housing opportunities to low and moderate income households, while also improving neighborhoods through community development opportunities and management of innovative housing initiatives. Our vision is a region that is building better health, living safely, and thriving to advance a just, sustainable, and resilient future for all. Our mission is to support low and moderate income families in achieving stable and affordable housing in San Diego County. It's now more than ever crucial to continue to build upon the county's recent successes in creating and preserving affordable housing opportunities for vulnerable population. As a region, we continue to face a housing affordability crisis. Almost 9 out of 10 low-income households are rent-burdened, which means they spend more than 30% of their income on housing. For example, the average 2-bedroom rent is currently between $2,700 and $3,000. Affordable rent for our most vulnerable families is between $917 and $1,600. County efforts have resulted in the investment of $175 million through funding sources such as the Innovative Housing Trust Fund, No Place Like Home program, and excess county land to support the creation or preservation of 3,390 permanent affordable housing units within 44 developments. These will serve over 35,000 families over the life of the developments. In total, since 2017, 10 developments providing housing for an estimated 835 low-income individuals and families have completed construction. Additionally, Housing and Community Development Services continues to play a critical role in the pandemic response, especially for those who are experiencing housing instability. Housing and Community Development Services has managed multiple allocations from the state and federal government to support low-income renters through the Emergency Rent and Utility Assistance Program, or ERAP. The county has successfully awarded over $205 million on behalf of 20,590 households. On average, households receive $6,800 for rent and utility assistance. We are also making investments to address homelessness in the unincorporated area, which includes emergency housing using local hotels and motels, and permanent housing through the county's local rental subsidy program. Over 900 people have been provided hotel shelter and services to date, and of those, 242 have successfully secured permanent housing. Between the county's ERAP, Rental Assistance for Small Landlords program, and Security Deposit Assistance programs, HCDS has assisted 63,000 people. Fundamentally, stable housing is the cornerstone of a healthy future and a critical tool to disrupt and break the chain of poverty. Looking forward, HCDS is administering ongoing COVID response efforts that benefit the households and communities affected by the pandemic. Through programs that support renters and the local rental economy, an estimated 8,000 additional households will receive emergency rental assistance in the coming months. The County Housing Authority, which assists 23,000 people through the Housing Choice Voucher or Section 8 program, will undergo a transition to a new case management system, which will enhance program delivery and will add customer-oriented abilities. Through the affordable housing initiatives, HCDS will support the county's framework for ending homelessness by providing permanent, supportive, and affordable housing to vulnerable residents. Currently, there are 954 units under construction, and 21 developments with 1,600 units have been awarded and will begin construction in the near future. This new construction stimulates our local economy. For every 100 units of affordable housing developed, between 100 and 160 construction jobs are created in the first year, and 30 to 32 jobs are created in ongoing years of operation. The county continues reimagining county excess land as affordable housing, with 5 county sites already under development by affordable housing developers and 3 more on the way. HCDS will also be releasing notices of funding availability, making available home investment partnership funding, project-based vouchers, and Home American Rescue Plan funding. HCDS has embarked on a joint effort with the county's Planning and Development Services and the county's General Services to study multifaceted, transformative housing solutions. This includes the evaluation of the potential for a perennial regional housing trust fund, as well as preservation strategies for naturally occurring affordable housing. These efforts complement our existing housing and community development programs, which serve 13,500 individuals. Additionally, HCDS will continue its efforts in addressing homelessness in the unincorporated areas through the Regional Housing Assistance Programs and the Local Rental Subsidy Program. As part of our core service delivery program specific to some of our most vulnerable populations, Housing and Community Development Services will provide rental assistance to formerly homeless veteran households with Veterans Affairs supportive housing vouchers, continue recruiting landlords, and conducting fair housing tests. Our key performance measures include providing rental assistance to at least 665 veterans through the VASH program, and recruiting 180 new landlords as part of a multi-year effort to increase the number of landlords participating in the County Housing Authority's programs, and conducted 40 fair housing tests by secret shoppers in rental units throughout the county to proactively educate and engage landlords about housing discrimination. Housing and Community Development Services recommended budget for fiscal year 22-23 is a total of $83.4 million and 156 budgeted FTEs, or full-time employees. The overall budget decrease of over just $30 million is in alignment, removing one-time programming of affordable housing related to the IHTF funding and homelessness investments, including dollars previously awarded for the Innovative Housing Trust Fund, and projects funded with one-time CARES Act funding issued by the U.S. Department of Housing and Urban Development. Excluding these adjustments, for completion of these one-time items, there are increases in other areas, including 26 new positions. The largest increase in positions will support Housing Choice Voucher programs to administer and issue additional housing vouchers awarded by the U.S. Department of Housing and Urban Development. Housing and Community Development Services administers housing assistance programs on behalf of the Housing Authority. However, as a separate legal entity, the Housing Authority's budget is not reflected in this budget nor in the overall county budget. For reference, the total budget for the Housing Authority is $190 million, of which $179 is for the Section 8 Housing Choice Voucher program. This slide shows our proposed significant budget changes. At the top of the table is the increase of 26 positions, as referenced on the last slide. While the majority of the housing programs are funded by the U.S. Department of Housing and Urban Development and some state funds, there is an increase of general program revenue for some administrative costs that are not fully funded, and also for the addition of 5 new positions that were requested that will focus on the county's increasing affordable housing efforts, including expanding unlocking county excess land and regional capital investments and unlocking of regional excess land. There's also an additional $500,000 in GPR added for contracted affordable housing underwriting services. You will see near the bottom of this slide. Bolstering resources for affordable housing work overall is critical to continuing the county's upward trajectory in promoting the creation of units for low and moderate income households and special needs residents to reduce homelessness and those who are at risk of homelessness. You will also note $11.9 million in one-time Home American Rescue Plan funds, and this is reflected in this budget for this year. And for the county's American Rescue Plan framework, the second year of enhanced regional tenant legal services for low-income households facing eviction is budgeted at $3.3 million. Housing and community development programs align with and support the county's strategic plan initiatives. Affordable housing programs reduce poverty and promote economic stability for vulnerable populations. We promote sustainability in creating new programs and existing programs by reducing paper communications to and from customers through paperless notifications and online portals. We are also incentivizing housing development in VMT favorable areas and rewarding the use of sustainable development strategies and construction materials. And we have aligned to the strategy of equity. We affirmatively further fair housing in the region through education and outreach, in fair housing practices laws, and in regulations, which prohibit housing discrimination. And many of our programs directly break the chain of evictions and overcrowding that limit our families' future prospects. Housing and Community Development Services enhances the community by adding to the regional supply of dedicated affordable housing, increasing the production of deeply affordable units, and creating more diverse and accessible housing in resource-rich neighborhoods. And we empower families and individuals through rental assistance programs that provide stability in housing, which leads to better overall quality of life. Thank you. I'm happy to answer any questions that you may have.
Thank you, David. Thank you for all of the work we're doing around this. Let me go first to Vice Chair Vargas.
Thank you, David and team, for all the great work around this particular issue. It's going to take obviously a comprehensive solution between public and private partnerships to be able to identify some of this. But we saw many housing accomplishments during the year, especially with our local dollars invested in housing with the IHTF. And so I think it's really important that our local resources, that we complete financing for various affordable housing developments and recognizing the value of this local program. And I just wanted to find out what is the possibility to explore various funding sources to identify ongoing funds that can be allocated to renew IHTF every year.
So the Innovative Housing Trust Fund has been a very successful tool. It's funded by county funds. We also leverage state and federal resources whenever possible. A very recent example is an application for home key funds through state funding. We are ready and prepared. We've built a staff around the opportunity to leverage our own excess land, unlock regional municipality excess land, and any resources that may be available to develop more and more units regionally on a continuing basis.
Okay. So does it have to be a formal request, or is it?
What you've said we'll put into this, but it will not be reflective in this year's budget unless there's a formal change letter request.
Okay.
And then we would have to identify where those funds would come from because we have to balance the budget.
Understood.
So to have that in our thought process as we're going forward, this comment is certainly sufficient to do that.
Okay, thank you very much. And then also, appreciate that. And then for the first-time buyer program, how can we identify county funds to help streamline the process, for example, waiving fees or expanding outside of the 80 AMI? I think it's really important for me to find ways to make it easier for and more attainable for folks to seek these programs and resources. I know we have a lot of really great programs, but I think the median income in San Diego actually changed yesterday, and it went to some crazy amount. And so I'm just trying to figure out other ways that we can really change these numbers as well. So as we're moving forward, you can think about that as well.
Thank you, Supervisor. Our current program is funded by Home Investment Partnership Funds.
Yeah.
The cap for area median income is 80% of area median income. We can definitely explore adjusting those fees that are part of our first-time homebuyer program. And it's particularly challenging now because the cost of housing continues to rise and is basically pricing out our first-time homebuyers.
Okay. And then the equity question.
Yes. It is a valuable tool for us. It was a new process. What we discovered is that it forced us to ask some questions about how we communicate, particularly for our department, how we communicate with our stakeholders, both participants and outside entities. And ultimately, we found that in our Section 8, our ERAP program, our HOPWA, and Emergency Solutions Grant, we're able to enhance our communication and really it forced us to focus. It didn't force us. It was helpful in focusing our efforts and how we communicate and expanding those efforts.
Thank you very much. Thank you, Chair.
Thank you. Supervisor Lawson-Remer.
Yeah, I just really want to acknowledge and recognize how much work you've been doing this year. I think housing has clearly come to the forefront of this board as a priority of all of us, and there's just been a tremendous amount of work, and lots of new units on the market, a lot more underway and in production. Really, I think, strong work on identifying county lands that are good opportunities for investments. I think the only real question I have for you is whether you feel like you have appropriate staff capacity to sort of take on this leadership role that the county has never asked your department to take on before, and especially as we continue to do the hard work of meeting both our housing goals and our sustainability goals. And when you have, sort of two dual mandates, it definitely makes the effort more difficult. So that is, I partly just want to acknowledge what a leap forward this has been compared to past years, but also ask whether you have the leadership staff that you need to lead this effort that we've been asking you to lead.
Supervisor, thank you for your question. So this is a very special moment in affordable housing development in this county. The county has positioned itself on very much an upward trend. The leadership structure that we have at HCDS also works in partnership with all the leaderships and the team in HSEC, Office of Homeless Solutions, of course our staff at General Services, Planning and Development Services. So if we look at the leverage that we can have between all of our different units and departments, I think we're very well positioned to take on what will be hopefully new initiatives, an expansion of existing initiatives. And I believe it'll be fruitful for us to do that. One note as a staffing question, right now we're very much competing on a statewide basis for the skill set in the development of affordable housing. And you'll see in this budget that there's been money set aside for underwriting services. I can envision that will only continue to grow as we expand our efforts. So, we'll recruit new team members that have that skill set and continue our underwriting services, and I think we're very well positioned for the future.
So just I think as you think, and I guess probably won't impact this budget currently, but as we look forward and, we get quickly into budget development for next year, we know we're asking you to do a lot. And if you are at a staff capacity constraint to not be able to deliver, I think letting us know so that we don't expect you to perform miracles without adequate staffing.
Thank you, Supervisor.
Thank you.
Can I jump in for a minute? Thank you, Supervisor, for that question. David's being very thoughtful in his remarks. There's a shortage. There's no doubt a shortage, and you're seeing it, the strain, and he's working to address that, and we've added resources in this budget for that. But his point about our other departments that are working collaboratively together are also having those shortages. General Services probably is one of the biggest ones. We've been talking very much, Ebony and Nick and I, Michael, about how do we better suit our real property organization. Should we build a similar capacity in HCD, because affordable housing is really different from the General Services real property, where you're talking about leases and building construction and all of that. So this is a really important issue, and we are working it, and it's at the top of our minds. But I didn't want to give the impression that we have it resolved yet. But we will come forward. You'll see it in the budget presentations this afternoon. But we are adding resources. But this is an area where I think we may be adding more over the year.
That's very helpful. I mean, I think just looking at what we are doing and attempting to do versus sort of static capacity structurally, administratively. I do think we are not, it does not appear to me that we are structurally staffed to do what essentially we're asking to be done. So I know it's not reflected in this budget, but I think this is something we're going to have to solve over the coming year to make sure that we are staffing appropriately, because you can't work 24/7. So. Thank you.
Thank you. All right, thank you, David. Okay.
Next is Barbara Jimenez, our Community Operations Officer for Homeless Solutions and Equitable Communities. Barbara?
Thank you. Good afternoon. At the direction of the Board of Supervisors, the Department of Homeless Solutions and Equitable Communities was established in July of 2021 to achieve enhanced coordination of existing and future programs, services, and efforts helping end homelessness in the region, to promote community engagement and foster a community that is welcoming to all new residents. We achieved this through the department's 3 offices: the Office of Homeless Solutions, the Office of Equitable Communities, and the Office of Immigrant and Refugee Affairs. Our age-and-wide vision is to have a region that is building better health, living safely, and thriving to advance a just, sustainable, and resilient future for all. To achieve this, our department has made it our mission to coordinate homeless reduction efforts, promote regional community engagement, and provide resources and support for existing and newly arriving residents in San Diego County. In less than a year since its inception, Homeless Solutions and Equitable Communities has the following key accomplishments: the development and adoption of the county's first ever strategic framework for ending homelessness, which operationalizes the board's guiding principles on homelessness and will maximize existing and future work by creating a unified strategic approach to ending homelessness. Our efforts include the launching and expansion of direct homeless services into all regions of the county through the establishment of outreach teams composed of social workers and street case managers to work directly within our communities. A total of 32 positions were added as part of this expansion of direct services. Since July 1st, our dedicated staff has conducted over 13,000 engagements with customers at more than 1,300 locations countywide and completed over 1,800 self-sufficiency transactions in the field that connected customers to medical services, cash assistance, and other key resources, including housing. The Homeless Solutions Direct Service Team worked with city jurisdictions, community partners, law enforcement, faith-based organization, and many other partners to make positive impacts in our communities countywide. The hardworking staff supporting the Office of Immigrant and Refugee Affairs successfully launched the San Diego County Task Force meeting for Afghan evacuees and established a steering committee and work groups to develop recommendations to inform a region-wide plan for services. These work groups have been meeting since January of 2022, providing a space for community members and partner organizations knowledgeable on this population to share concerns and increase awareness of challenges and opportunities, discuss the rollout of new housing opportunities, and launched a website with resources for agencies and families. The remarkable team of the Office of Equitable Communities is leading numerous efforts to enhance community engagement to meet the needs of underserved communities. For example, our Community Action Partnership saw 90% of aspiring community leaders that participated in the Resident Leadership Academy graduate, assisting in their efforts to make positive impacts in their communities. Additionally, we are continuing to promote community priorities through the reconvening of regional leadership team meetings throughout the county. While enhancing engagement and collaboration, these leadership teams, co-led with the community, continue to elevate the voice of the community and drive action on the ground to improve the health and well-being of our residents. We are proud to share that in the work we have done so far, our South Region Live Well San Diego leadership team received one of the highest levels of recognition in the Communities of Excellence Assessment and Recognition Program. And staying true to our commitment to the community over 7 years ago, we are excited to not only share with you the groundbreaking of the new Southeastern Live Well Center, but the vision of community engagement this project represents. As mentioned earlier, our department continues to uplift and engage with the community. The development of the Southeastern Live Well Center is an example of this. This includes inviting members of the public to provide their input on the photo murals and public artwork that will be displayed at the facility, organizing community events and fairs, and hosting workshops for local artists. As our department continues to develop, we are excited to share some items we're looking forward to. In the new future, we are excited to begin implementing new programs focused on upstream prevention strategies that continue to serve persons at risk of or currently experiencing homelessness. Using funds from the American Rescue Plan Act, our department is leading efforts in the following areas: LGBTQ+ affirmed homeless services and housing, the development of an eviction prevention system program, flexible funding for immediate needs, which removes financial barriers that prevent households from obtaining and sustaining housing by incorporating flexible funding as part of the homeless services team while they're conducting outreach and case management. And lastly, the Compassion Emerging Solutions and Pathway to Housing program will provide services offering housing interventions and safe parking, emergency sleeping cabins, and recreational vehicle camping. We're excited to fully step up our team of regional community coordinators within equitable communities to strengthen, build, and facilitate collaboration among our community partners to address and promote opportunities to improve equity, economic inclusion, poverty reduction, and access in the region. In addition to cultivating relationships with our community partners through our regional community coordinators, we're also really excited about developing our community health worker model within our county workforce to better facilitate access to services and improve the quality and cultural competence of services delivered to our clients, particularly among underserved populations. And looking ahead, we will continue to develop the infrastructure of the Office of Immigrant and Refugee Affairs, develop a strategic plan for the office, and establish a physical central location and outstation outreach sites for this office to make it easily accessible and engaging for the community. For fiscal year 2022 to 2024, recommended metrics, we aim to achieve the following numbers for our key performance measures: 66% of refugee employment service participants to receive unsubsidized employment. In partnership with the Public Safety Group, ensure 75% of participants in the Community Care Coordination Veterans Programs are immediately housed after release from custody, and that 70% of participants enrolled in the Community Care Coordination are permanently housed. Also complete 20,000 direct service outreach engagements or interactions countywide with persons experiencing or at risk of homelessness. This metric measures the number of interactions county staff has made in providing direct services to individuals, but is not a count of how many people have received direct services. And this is an important distinction, as it may take more than one encounter to build rapport with a customer, or there may be different needs at various times, especially with vulnerable populations. Connect 2,000 individuals who are at risk of or experiencing homelessness to self-sufficiency services. Ensure 75% of households enrolled in the Coordinated Eviction Prevention System program shall avoid eviction and become stabilized in their housing. The goal is to serve a minimum of 100 families annually. Permanently house 100 transitional youth through Housing Our Youth program, which provides specialized assistance to youth and young adults up through age 24. Achieve a 90% graduate rate among Resident Leadership Academy participant, emerging leaders within our communities who are now empowered with the knowledge, tools, and strategy to make positive changes at a neighborhood level. And lastly, provide outreach and education to residents to create positive change through equity, health, safety, economic inclusion, and access for all by touching the lives of 9,000 individuals countywide. As our department continues to develop its programs, we look forward to adding additional key performance measures to track our outcomes to ensure our equitable and positive impacts to our community. Homeless Solutions and Equitable Communities is proposing a budget of $52.8 million, which includes 156 positions. The net decrease in positions shown on the slide is tied to the transfer of the Office of Strategy and Innovation to the Administrative Support Department in the agency to enhance the alignment of integrated functions. Absent that transfer, 16 positions and over $25 million in new investments are being proposed to be added to Homeless Solutions and Equitable Communities. 16 proposed positions are noted on the top row, and that includes 12 community health workers, leveraging the new classification to pilot the rollout of the community health worker model within our county workforce. These trusted messengers will provide support to community members by increasing their knowledge and self-sufficiency through the range of activities such as outreach, community education, social support, and advocacy. 4 additional positions are requested to augment case management and community outreach efforts for safety net services and provide overall operational support to the department. We are increasing our budget by $23.7 million for continued efforts under the framework for ending homelessness, including areas such as the implementation of the Coordinated Eviction Prevention Program, expanded housing and service supports for people at risk of or experiencing homeless funding through the state's Housing and Disability Advocacy Program and Homeless Housing Assistance and Prevention Program. And lastly, I want to highlight the $10 million in one-time county funds for partnerships with cities to build service capacity in the region by acquiring shelters or locations to serve the homeless population. Our departmental operations under the Health and Human Services are aligned with the county's strategic plan and contribute to the overall success of the region. We aim to achieve sustainability by helping communities thrive now and in the future, by promoting and expanding economic enhancement opportunities in communities that are traditionally underserved, continuing to support newly arriving refugees and be a welcoming community to ensure access to all eligible housing, self-sufficiency, and employment resources. In the work we do, we continue to empower our department, Health and Human Services Agency, county enterprise, and our customers through continuous self-evaluation and improvement, leading the enterprise-wide collection of programmatic information regarding services and housing for people at risk of or experiencing homelessness, developing baseline criteria and measures for direct outreach services, and this includes establishing metrics, dashboards, and regular reporting and evaluation for improvements. We continue to strengthen our communities and create opportunities for San Diegos to grow, connect, and thrive by increasing access for individuals or communities to use their voice, their vote, and their experience to impact change. Support the immigrant community through participation in the Immigrant Rights Legal Defense Program Advisory Board. And in support of our immigrant community, we also recognize the interconnectedness between the Cali Baja region and tackling the shared health and community challenges and opportunities as one. And doing so, we continue to cultivate community partnerships through our ongoing binational efforts. In addition to support for the immigrant population, we also support the refugee and migrant population by monitoring and responding to their arrival, with particularly the potential lifting of Title 42, which is a federal public emergency health order prohibiting entry into the United States, when the Director for Disease Control believes there is a serious danger to the introduction of communicable disease into the United States. In support of federal and state agencies and local non-governmental organizations, the county is preparing for the potential surge of migrants through the San Diego ports of entry. And true to the name of our department, we promote equity by working with the hardest to reach and most vulnerable populations to ensure all residents have access to service and information to better manage challenging situations with a strong emphasis on health, housing, and economic opportunity. And we do this by collaborating with our housing authorities and cities across the region to reduce homelessness and expand emergency, interim, and permanent housing. And lastly, ensure refugee employment services participants are engaged in unsubsidized employment. Our department continues to align our various programs and services to the county's strategic plan to ensure that all San Diegans are healthy, safe, and thriving. Thank you for your time this afternoon. Subject to any questions, this concludes my portion of the presentation.
Wonderful. Thank you. Thank you, Barbara. We've got a lot of really complex and difficult things, I think, under your purview right there. Certainly homelessness being top of the mind for public attention, but all of the various aspects certainly very important to what we're doing as a county. So appreciate all the work. Let's go to Supervisor Lawson-Remer.
Yeah, I mean, first of all, I just think it's a night and day and a huge step forward to have the concentrated effort and this, Department of Homeless Solutions and Equitable Communities that we haven't had, and I think was a huge leap forward. I think I just wanted to better understand, looking at the significant budget adjustments, which is page 53. Just making sure I'm reading this clearly, that the staffing increases, the eviction protection programs, the funding for minute needs programs, sort of all these big increases are being funded with program revenue that we're able to draw down from state and federal sources.
Correct. So let me see. The only one that is not, which is local funding, would be the $10 million in the city's grants, the one-time county funding partnership.
And just to better understand what is different about the services that we would be providing, that we're providing with those local cities, that makes those services not eligible for state and federal drawdown.
That one could do for the.
Pushing the wrong one. So the $10 million supervisor is the initiative that we are proposing that's actually going to be coming to the board on Tuesday for the capital investments for city partnerships to really stand up more shelters or emergency sheltering solutions.
Okay.
So the grant increases that we have in HSEC's budget are really more specific to services for homeless individuals.
And so those are really, that's all one-time money, that 10 million.
The 10 million is one-time general purpose revenue, yes.
Okay. Great, thank you. I mean, again, I think you all are working really hard. I know going to be coming back with a more robust framework in the coming months, and this is obviously a huge priority for all of us, so thanks.
Thank you. Vice Chair Vargas.
Thank you, Chair Fletcher, and thank you for all your work, Barbara, particularly around a lot of new programs, a lot of the offices that we've created, including the Office of Immigrant and Refugee Affairs. I'm excited about the work that's going to be done, particularly in that office, and I know that we're thinking about expanding and creating a welcoming center in National City and some other areas. And so is that information as part of this budget as well?
So that information is not part of this budget. We're going to be leveraging one of our self-sufficiency family resource centers. We anticipate that any additional costs that will come out of that, we're able to leverage from the funds coming out of there.
Okay.
Yeah.
Fantastic. And then the other question that I had was, of course, the equity question, how you use your tool.
So I know there's been a lot of folks have answered the question. I think for us, especially in the Office of Equitable Communities within this department, it was an opportunity because our team is very closely knitted to Equitable. So I think that when they came into the process, they had an idea that we do this, we got this. But once they started going through the process, it really brought to light some new opportunities to look at things in a different way, to kind of push it. One opportunity, or even I would call a little bit of a challenge to keep in mind for us as a learning opportunity, was when you have new programs coming up as quickly as we've been having them coming up, that sometimes with the equity tool, you're trying to move so quickly that one of our lessons learned is let's make sure that we're very, very thoughtful as we're bringing up the new program. So just offering both of those perspectives as we move forward.
I appreciate that. Thank you very much.
All right. Thank you. Thank you, Barbara and Tim.
Next is Dr. Liz Hernandez, Director of Public Health Services, along with our Public Health Officer, Dr. Wilma Wooten. Liz?
Thank you, Nick, and good afternoon, Board of Supervisors. The Department of Public Health Services is a nationally accredited public health department since 2016 and provides services that identify and address the root causes of priority issues that advance health, equity, and well-being among all San Diego County residents. Our mission is to promote health and improve quality of life by preventing disease, injury, and disability, and protecting against and responding to health threats and disasters. There is no way we could be successful in meeting this mission without the hard work and dedication of all of our public health employees and our community partners. Now please welcome Public Health Officer Dr. Wilma Wooten.
Thank you, Dr. Hernandez. Fiscal year 21-22 accomplishments will be reviewed for preventive services, surveillance, infectious disease control, and public health preparedness and response. For preventive services, the department has submitted its re-accreditation application to the National Public Health Accreditation Board on May 2nd. We've transitioned the local immunization information system to the California Immunization Registry, including the transition of over 40 million records, and developed a robust health equity framework, racial equity dashboards, and health equity reports, resulting in 20 documents published to identify and measure systemic health inequities. For surveillance, the department has implemented the Centers for Disease Control and Prevention Opioid Epidemic Grant Strategy to develop a surveillance system which aligns with the agency's larger harm reduction strategy. We've transformed our community profile data into a Tableau platform, making San Diego County demographic data more accessible and usable by the public. And we've engaged local hospital systems to reestablish a fetal infant mortality review board. For infectious disease control, We have continued to lead the COVID-19 pandemic response with almost 932,000 tests performed during fiscal year 21-22, over 2.4 million vaccine doses administered. Actually, to date, 94% of San Diegans have had at least one vaccine dose. Over 83% are fully vaccinated. 58.3% of those eligible have received their first booster dose. Also, almost 5.8 million personal protective equipment items were distributed. We have executed all COVID-19 one-time only grants, and they total, there's a total of 19 of those, and the total dollar amount is $213 million. We've launched the Droplet Digital Polymerase Chain Reaction, or ddPCR test, for the same-day beach water testing, the first coastal community in the nation, performing 300 tests per month, approximately. We've implemented 3 elimination initiatives to combat infectious diseases, including HIV, hepatitis C, and tuberculosis. The Public Health Preparedness and Response Branch has increased its Medical Reserve Corps volunteers from 1,722 to 5,681, providing 1,175 volunteer hours of service. Collectively, all of the public health services programs serve the over 3.3 million San Diegans and the 35 million annual residents. Dr. Hernandez will now provide comments on looking forward and future outlook for the department.
Thank you, Dr. Wooten. As we look towards the future, Public Health Services continues to prioritize efforts to address health inequities, including the implementation of the Healthy Places Index 3.0 across the departmental program services and activities. We will also be developing a poverty report focused on the 5 lenses of health equity: age, gender, geography, race and ethnicity, and socioeconomic level where possible. We will also be co-developing a county-wide food procurement policy with the Land Use and Environment Group, as well as rolling out a community food production program. As part of the agency's larger harm reduction strategy, we will be launching a robust opioid public education campaign utilizing the Overdose Data to Action grant, led by Public Health Services, Behavioral Health Services, and Medical Care Services departments. You will hear other department directors elaborate on the strategy's activities in this presentation. As part of our new normal for surveillance activities, we will be institutionalizing a wastewater early detection warning program, and this will be key as we continue our COVID-19 response efforts. Additionally, from an infectious disease control perspective, we will be reestablishing a sanitation and hygiene survey to municipalities, assessing sanitation practices and restroom availability. Focusing on data-driven approaches, we will be exploring new performance measures for the California Children's Services Branch, which serves over 19,000 children with chronic illness or disabilities. In the area of organizational excellence, we'll be building on existing efforts to document and clarify public health roles and responsibilities with local municipalities in order to foster our continued partnerships. Lastly, identifying and acquiring federal, state, and CDC infrastructure funding will allow us to solidify a permanent public health services department facility and expand our efforts around workforce development. The recommended fiscal year 22-23 budget for PHS is a total of $216.4 million and includes 730 full-time employees spread over 6 programmatic branches. You will notice that the last 2 program areas of Regional Public Health Services and Medical Care Services Division have been zeroed out, as they are now part of the new Medical Care Services Department, which you will hear from shortly. This transfer is what is driving the decrease of 107 FTEs. Excluding the transfer of positions, the recommended budget includes 71 new positions for public health services. These new positions are spread across various program areas to bolster several areas of public health, including maternal, child, and family health services programs, HIV and STD programs, and disease surveillance programs, amongst others. Also included are new positions to support Clean Syringe Services Program as part of the agency's harm reduction strategy, a new position to augment water quality testing and immunization services. Lastly, on this slide, I want to make mention of the $161 million overall year-over-year decrease in the budget. As you've heard in other presentations today, there are several reductions throughout the departments to remove one-time only costs that were budgeted to respond during the height of the pandemic. The largest decrease is in public health services, as the majority of the county's response efforts for our T3 test, trace, and treat efforts were budgeted here. Absent the reductions for one-time response efforts and the transfer to the new medical care services department, the public health services budget has over $21 million of increases. As you will see on our significant budget adjustment slide, most of our spending is in the area of salary and benefits for the new 71 positions, as well as retirement and salary adjustments. I do want to mention that this increase proposed is on top of 163 new positions added to the public health department throughout last year's budget process. While some of these positions have required county funds, we have received a significant infusion of grant funding over the last couple of years and expect ongoing state funding to help sustain positions in the out years. And while there are reductions in the large one-time amounts budgeted for the pandemic response, there is new grant funding budgeted to enhance preventive health services programs to immunize individuals against COVID-19. And there is a $1.5 million increase for laboratory molecular sequencing supplies to enhance surveillance, monitoring, and detection of infectious disease threats in the community. The last item I want to highlight is $2 million added to the budget for 2 new Live Well on Wheels vehicles and a new mobile public health laboratory vehicle. These vehicles will be funded through public health grants and continue to bring services to residents. Now, please welcome back Dr. Wooten.
Thank you, Dr. Hernandez. The Public Health Services Department met or exceeded performance metrics for 14 of 19 objectives, with 5 objectives not met as designated by the asterisks. On this and the next slide are highlights for 10 of the department's 19 objectives. On this slide, there are 3 met and 2 not met objectives. California Children's Services made medical determinations within 5 days on virtually all or 99% of 4,000 cases, facilitating access to care for children with serious and chronic illness and disabilities, thereby exceeding its original target of 97%. The immunization program exceeded its children with age-appropriate vaccines target of 99%, accomplishing 100% of the 16,000 children served in the public health centers in our regions. The refugee health program was below target for refugees completing health assessments due to difficulty accessing health services during the COVID-19 pandemic. To account for this challenge, the State Office of Refugee Resettlement waived the 90-day requirement for completion, but staff and contractors are still following the original time frame. The foster care program was above target at 92% for ensuring foster children receive timely health exams. However, dental exams for the same children were at 79% compared to the 90% target, which is attributed to the COVID-19 pandemic. Public health services demonstrated operational efficiencies in 3 of the 5 measures shown on this slide. The HIV/STD hepatitis branch continues to exceed its target for ensuring clients with newly confirmed HIV diagnoses get connected to care. This metric is vital because it supports the Getting to Zero initiative. The Chronic Disease and Health Equity Unit exceeded its focus to recruit 5 new Live Well retailer participants each year, adding 9 new markets and reaching a total of 50 of these retailers, now offering healthier options for residents in communities where it is difficult to make healthy choices. Public Health Services has a strong culture of quality improvement, which is also a requirement for maintaining our public health accreditation status and supporting continuous improvement by engaging branches to identify and solve operational inefficiencies. Although these efforts were impacted by COVID-19, several new projects have been implemented and include streamlining the process to confirm COVID-19 case data, improving the appointments process for CCS clients, and improving efficiencies in licensing for tobacco retail licensing program, and ultimately its impact in reducing youth access to and use of tobacco products. The last 2 objectives on this slide are related to communicable diseases and were not met. For communicable disease investigations, we are at 98%, which is close to, but below the 100% target. We set such a challenging target to ensure this work is prioritized. The selected diseases are hepatitis A and meningococcal disease because they pose a very high enough risk to require an immediate response, and the county has had outbreaks in these 2 areas previously. This measure does not include COVID-19 cases. As the board is aware, PHS launched the TB Elimination Initiative in 2019. One strategy that was underway in 21-22 is getting health systems and providers to report TB cases immediately to PHS within 1 working day of the start of treatment. Here we project that we will be at 92%, which is below the 98% target. Fortunately, the delayed cases were not highly infectious. Finally, I will review PHS's alignment to the county strategic plan and its strategic initiatives. For sustainability, the department will reduce emission and the office footprint as Public Health Services transitions to alternate and new facilities. We will work with Land Use, Environmental Group, and the Department of Purchasing and Contracting to recommend board policy to support local, sustainable, and equitable county food purchases. For equity, we will ensure infants served by the Black Infant Health Program have a normal birth weight through services and support. We will ensure foster children receive timely health and dental exams, and refugees complete their health assessments within the designated timeframes. To empower the public, we will ensure children with chronic and other serious conditions who are referred to the California Children's Services have their medical eligibility determined timely. We will conduct 8 quality improvement projects to improve excellence and engage staff in resolving barriers. For the Community Strategic Initiative, we will continue to connect clients with newly confirmed HIV diagnosis to primary care providers within 30 days, again advancing the Getting to Zero initiative. We will also ensure active TB cases are reported by the community to PHS within 1 business day, and that active TB cases are also tested for HIV. This concludes our presentation, subject to any questions from your board.
Thank you, Dr. Wooten. Thank you, Dr. Hernandez, for the presentation. Obviously, the last 2 years have pushed our public health department in ways we never imagined before. But I think coming out of this, how we stabilize, how we continue to build that foundation and recognize it's so much more than just COVID, and it always has been and it always will be as we continue to move forward. Let me go to my colleagues, starting with Vice Chair Vargas.
Yes, thank you, Chair. And it's been wonderful to see the work that has been done. If it wasn't for the data that the Public Health Department used, many of our communities would not have access to vaccines and resources. So I know that a little biased because I know that you've been using equity to begin with, but if you can just share a little bit about how you've used this tool, I would really appreciate that.
Happy to. As you shared, for the past 20 years, health equity has been really woven into the work that we do in public health services. And the budget equity tool really allowed us the opportunity to ensure equity considerations in all of our programs and initiatives. So it was really helpful to really highlight and ensure that community input is in that tool. And as we continue to get more experience with the tool, we'll definitely provide more opportunities on how to best streamline the tool and make it more aligned. So thank you for that.
Supervisor Desmond.
Thank you, Chair. Well, Dr. Hernandez, it was great to hear you mentioned about a grant potentially for the fentanyl overdose or overdoses here in the county. Is that correct?
We have been, for the past 4 years, have an overdose data to action grant that we have been managing, and Dr. Wooten actually leads that grant. Do you want to share a little bit about your grant?
Sure. Supervisor Desmond, that is a grant that is focused on opioid surveillance and then prevention. So there are 5 strategies. The first, strategy 3, is on surveillance, and then the other 3 are focused on prevention. Strategy 4 is focused on the healthcare provider, making sure that they identifying what's the baseline and making sure that they're utilizing resources that are on the Cures 2.0 state dashboard for providers when they prescribe. Strategy 7 is focused on the healthcare system. And then strategy 5 and 6 are focused on the healthcare system, particularly behavioral health and treatment. And those 2 strategies are led by behavioral health.
Okay, I guess I don't know enough. Is fentanyl an opioid?
No, sir.
No. I've seen different heads nodding
Well,
around
it's an illicit drug, and it is sold on the streets, and there's fentanyl prescribed, but then there is.
I guess we're in a budget hearing.
Yes.
Do you have money to help fight the fentanyl dilemma that we've got coming up? And I know you're coming back soon with a program that we asked for that, but I don't know if there's going to be any money necessary. And it seems that would be, we may need some dollars just because of the rate that people are dying from fentanyl. And as mentioned, it's a poison in our community. So I'm just curious.
So fentanyl is an opioid, but what's being sold on the streets is contaminated, and that's why it's being stated that it is a poison to people.
So do we have a line item or dollars for the fentanyl issue that we've got going on, or did we just come out of these grants?
The opioid dollars are not specifically for fentanyl. They are for surveillance of all types of opioids, including fentanyl. And also preventing, from the prescriber's perspective, as well as the healthcare system. But those are on the prescribed opioids. This particular grant is not focused particularly on street level, but we are integrating our activities and addressing funding where possible to work with the harm reduction strategy, which has a large component of their strategies dedicated to fentanyl use. And you might hear more about that in the behavioral health.
Okay. Go to Dr. Bergman.
Yeah, I just want to make sure if we're talking budget, and I know there's going to be a program coming forward, and I don't know if there's going to be dollars for it or not. I'd like to know or hear that there is, and if there's not, maybe we do something about it. Pardon me?
Yeah, we have opioid settlement dollars coming.
How much is that? Do we have any idea?
Millions.
100 million.
It's millions.
Okay, well, if those could, and have those dollars been directed?
No, we've got a whole effort underway to kind of come up with a plan around creating a comprehensive comprehensive opioid investment strategy for the board to consider.
And is that going to include fentanyl and with the fentanyl?
Yeah, let's
prices?
go to Dr. Bergman. We'll
Yeah,
talk about the overlap between the 2.
Yeah, really quickly. Thank you, Chair and Supervisor. Good afternoon. Good to see everybody. So yeah, there, with the behavioral health behavioral health services recommended budgets, this is an issue that will be addressed. Fentanyl, of course, is an important opioid kind of in the landscape of overdose risk right now. And so as part of the comprehensive harm reduction strategy, there will be some requests related to that. And then also ongoing public messaging that I know you've taken a particular interest in, Supervisor.
Well, I just want to make sure if dollars are necessary here in the coming year for opioid or fentanyl, or it just seems to be a doubling. The deaths are doubling just about every year here lately, and so it's really a big issue. And for me, and we've been focusing on, and Supervisor Lawson-Remer as well, we want to make sure. It's budget time. Is there money for fentanyl and trying to get the programs out there and get people aware and hopefully reverse that course of fentanyl deaths?
I really appreciate you bringing attention to it.
Supervisor Desmond, I just want to also interject is we have looked at the components that are allowable for the funds that will be coming down the pike for the opioid settlement. So we're looking at what can we spend funds on. We're looking at what are we already doing so that we can identify the gaps and come up with a plan. So once the amount that is going to be allocated to our jurisdiction is provided, then we would socialize that information with the Board of Supervisors. But we are working with the harm reduction strategy. We actually have a meeting coming up on May 23rd to further review, but we've been working on this process probably for about a month to 6 weeks now.
Okay, thank you. I just love to see the results, and hopefully we have dollars to fight this fentanyl crisis. Thank you.
Great, thank you.
Next is Dr. Eric McDonald, our Chief Medical Officer and Director for Medical Care Services.
Good afternoon, Supervisors. The newly created Medical Care Services Department oversees and delivers agency nursing and pharmacy operations, provides clinical expertise in an array of disciplines, and implements initiatives such as California Advancing and Innovating Medi-Cal, also known as CalAIM, and Justice-Involved Health. The mission of Medical Care Services is to ensure San Diego County is home to America's premier local wellness delivery system with emphasis on quality, equity, sustainability, and transparency. During fiscal year 21-22, Medical Care Services has been a division within Public Health Services, and our accomplishments were integrated into the presentation by Drs. Wooten and Hernandez. But I would like to highlight our important work in the COVID-19 response. This includes the testing since the beginning of the pandemic, the nearly 500,000 vaccine doses administered by our own public health nurses since December 2020, as well as efforts to combat health misinformation, educate the public and healthcare providers in sector outreach, and increase access to life-saving monoclonal antibody treatments for COVID-19. Medical Care Services also provided nursing case management and home visiting services to support pregnant women and families, negotiated and updated county agreements with the 7 local Medi-Cal managed care plans, and established the Office of Justice-Involved Health, including collaboration with public safety partners on alternatives to incarceration. In fiscal year 22-23, we will complete the formation of the new Medical Care Services Department, which includes direct nursing and pharmacy services and providing expertise to support programs that improve the health and well-being of children, older adults, justice-involved individuals, and persons receiving Medi-Cal benefits. Medical Care Services also includes San Diego Advancing and Innovating Medi-Cal, SDAIM. This is the local implementation of CalAIM, a multi-year initiative launched by the State Department of Healthcare Services to improve the quality of life and health outcomes for over 1 million San Diegans receiving Medi-Cal benefits through whole person care approaches and addressing the social determinants of health. Since Medical Care Services has been a division within public health, there are no departmental performance measures prior to the latest fiscal year. For this operational plan, we are introducing 3 key performance measures to monitor nursing and pharmacy programs. Specifically, 95% of patient encounters in the San Diego County Psychiatric Hospital and Edgemoor Distinct Part Skilled Nursing Facility will have a pharmacist review current and new medications for compatibility to ensure smooth transitions to and from the hospitals. To ensure nurses are receiving high-quality training through the Public Health Nurse Residency and the Nursing Essentials Program, we will maintain at least a 4.5 out of 5 overall satisfaction rating from the program participants. Ensuring high-quality training is essential for maintaining a highly skilled nursing workforce that's staffing our county public health centers, responds to public health emergencies, provides in-home visitation services, and many other essential programs serving clients. To ensure first-time mothers are connected to the nurses through the home visiting program quickly, 100% of referrals to the program will be reviewed within 1 business day. This will ensure that these new mothers are connected to primary prevention services right away. Medical care services recommended budget for the fiscal year 22-23 is a total of $41.6 million and includes 222 positions. Our significant budgets adjustment slide, you will see here the biggest adjustment is the transfer of existing resources from public health services and behavioral health services to establish the department shown on the last row. The 29 new positions proposed in the budget are in the top 2 rows and represent the majority of the new spending requests. 13 of these new positions are tied to the implementation of SD-AIM to ensure the right resources are in place to steer implementation of this initiative for the county to drive successful outcomes in the quality of life and health for Medi-Cal beneficiaries. Another 8 positions are proposed for clinical nursing support to address increasing operational aspects of the nursing programs for regional clinic services, home visiting, emerging community needs, and other nursing programs. And finally, 8 positions are being requested to augment pharmacy staffing for program sustainability and to enhance the pharmaceutical service delivery to county programs. There is also a proposed increase of $1.3 million in operating costs, primarily to help strengthen nursing and pharmacy operations and include IT-related projects to support monitoring needs, patient registration, data solutions for managed care plans, and pharmaceutical care delivery through telecommunications. And investments in health consultants to support the newly created Office of Justice Involved Health are also included in that amount. During the next fiscal year, the activities planned across medical care services programs closely align with the county's strategic plan. Highlights include in the areas of sustainability, implementation of a patient medication dispensing machine pilot to increase access to medications without requiring a facility and staff for a full pharmacy at public health centers. High-quality training programs are an essential tool in retaining our nursing workforce. This will ensure the sustainability of services at our county public health centers, response to public health emergencies and emerging community needs, and in-home visitation services. Many of MCS's programs and activities address equity in our county. Patients served at the county psychiatric hospital are among the most vulnerable. In order to support and enhance patient care and medication safety, our pharmacy team will implement a clinical pharmacy program to evaluate new and current medications for patients as they arrive and leave the hospital. The SD-AIM roadmap will set the stage for expanding services, broadening Medi-Cal enrollment, and addressing social determinants of health. This will offer San Diegans a more equitable, coordinated, and person-centered approach to maximize health and well-being. As part of the roadmap, MCS will focus on identifying sources of revenue to invest in data exchange and information technology infrastructure to support the sustainability of the system improvements for Medi-Cal beneficiaries. To ensure excellent customer service and continuity of operation, we are adding an online scheduling option for appointments at the public health centers. The ease in which one accesses services is key to ensuring necessary tests, immunizations, and other care is received. Additionally, this leads to an enhanced customer experience, ensuring that they will continue to seek services provided by our regionally based public health centers. Activities that contribute to the quality of life for our communities include the home visiting programs, which are a powerful tool to improve the health and wellness of our community as they connect public health nurses with pregnant women to improve outcomes for mothers and infants through preventive health practices, sustaining community resources, and improving economic self-sufficiency. The shorter the time between the initial referral to contact with a public health nurse is a main driver of program engagement. Continued support of the county's COVID-19 testing and vaccination efforts by offering vaccination and testing at sites across the county, includes public health centers. Medical Care Services is proud to have established the Office of Justice Involved Health, which coordinates the justice-involved partners such as public safety, behavioral health services, public health services, and the community to address health-related concerns of the justice-involved population. Addressing the system of care as well as ensuring access to quality clinical services is an essential component to successful reentry, contributing to the overall health and well-being of the community. This concludes my portion of the presentation. I'm happy to answer any questions before turning it over to Dr. Birdwood.
Thank you so much. Thank you so much, Dr. McDonald. Let me go to Vice Chair Vargas.
Thank you, Chair. I really like the appointments and the scheduling system and stuff, but I'm going to ask you the question around equity and how you were able to use the equity tool in the work that you're doing as well, Dr. McDonald.
Yeah,
and thank you for all the work, especially with our binational community. I think it's been, your leadership has been so important. So I really wanted to say that. And I know that we're going to continue to do more, so thank you for that.
Thank you very much. Actually, I thought the answers that Barbara and Liz gave were outstanding in the sense that we sort of consider equity just to be our home base of the way we really do everything in both public health and now medical care services as a separate department. I thought the tool was interesting. Again, it's always good to have a new tool to look at and reevaluate how you thought you've always approached things. And I think that although it was utilized a little bit late in our budget development process, so I don't think we fully implemented it this time around, I think there's going to be good opportunity moving into the future, especially as we expand with SDAIM. I, in particular, thought that the question having to do with unintended consequences was a good one, because I don't think that's something that we consciously think of when we're actually using an equity lens. We sort of think, hey, how are we benefiting the population that we intend to benefit? But actually formally thinking through unintended consequences, I think, is a good question to be asking as we look at new programs and policies.
Thank you.
All right, thank you. Thank you, Dr. McDonald, for all your work.
Next is Dr. Luke Bergman, our Director for Behavioral Health Services.
Thank you. Good afternoon. The Behavioral Health Services provides essential mental health and substance use disorder services to people of all ages in San Diego County, working across 4 distinct domains. First, in partnership with our contracted community providers, we steward a vast and diverse array of community-based services that make up the behavioral health systems of care. We're also a direct healthcare provider with our San Diego County Psychiatric Hospital, our Edgemoor Skilled Nursing Facility, and county-operated clinics across the region. By statute and federal waiver, we are the specialty mental health plan for Medi-Cal beneficiaries with serious mental illness and substance use disorders. Finally, we act as a public health entity, working to measure and improve the behavioral health of every resident of San Diego County. Our mission is to make people's lives healthier, safer, and self-sufficient by delivering essential behavioral health services throughout San Diego County. And to accomplish this, we're working to transform the behavioral health system from one driven by crisis to one rooted in chronic and continuous care and prevention through the regional distribution and coordination of services. Over the past 3 years, Behavioral Health Services has served an average of 108,000 people annually across mental health, substance use, and prevention services. In fiscal year 2021, our specialty care system had over 150,000 adult outpatient encounters and over 180,000 children and youth outpatient encounters. The system also had nearly 84,000 inpatient bed days across the adult system and about 5,500 children and youth inpatient days. Additionally, in the same fiscal year, Behavioral Health Services had over 21,000 unique substance use disorder encounters. Services are provided throughout our coordinated system of care with over 800 service providers and county-operated programs. Over the last fiscal year, we've continued to advance the behavioral health continuum of care vision to better support the communities we serve. Work has progressed across 3 key domains of 1, crisis and diversionary services to keep people out of acute care, long-term care for people who need ongoing intensive support, and 3rd, acute hospital-based care with longitudinal care coordination. A few key achievements that I'd like to highlight from the last fiscal year include the opening of 2 community-based crisis stabilization units, the Vista Crisis Stabilization Unit in September of 2021, and last month, the grand opening of our newest community-based crisis stabilization unit in Oceanside, seen in the photo above, adding additional service capacity in the North region. We also expanded the mobile crisis response teams countywide and rolled out the first phase of a public messaging campaign to support general awareness of the new mobile crisis response team service throughout the county. Behavioral Health Services also applied for and was awarded $18 million in grant funding to further expand mobile crisis response team services to meet the needs of the community. In addition, the department continued to do innovative work to shift how we pay for inpatient care by anchoring rates to cost reporting and creating value-based payments to address public health needs. We dramatically increased post-acute and long-term care residential resources by increasing reimbursements and by making a commitment to secure all available beds in San Diego County for people from San Diego County. We've expanded our network of long-term care resources and increased capacity by 18% or 67 long-term care beds since fiscal year 1920. In addition to established areas of emphasis, we also work to advance new bodies of work, such as the county's comprehensive harm reduction strategy. Building on existing work led by Behavioral Health Services, Public Health Services, and the Medical Care Services Department, the comprehensive harm reduction strategy is a set of practical ideas aimed at reducing individual and community harms associated with drug use. We divide this work into 4 strategic domains. First, cross-sectoral convening. Second, healthcare integration and access. Third, housing. And fourth, workforce. We've made progress on all fronts, including ramping up naloxone distribution and establishing a community harm reduction team in central San Diego. We've continued to collaborate with other departments, including probation, the Sheriff's Department, and Medical Care Services to support robust behavioral health care for people with justice involvement in the county, including custodial populations. Finally, Behavioral Health Services continues to leverage opportunities offered by the state's CalAIM initiative to pursue better integration and coordination of care for Medi-Cal populations. In looking forward, we'll continue to make critical investments in services, capacity, and workforce. Some key areas I'd like to highlight include building out diversionary services, which include planning efforts for an East Region Crisis Stabilization Unit, along with further expansion of mobile crisis response teams, including additional phases of the public messaging campaign, with messages tailored to specific communities. We'll continue to focus on increasing long-term care capacity through enhancements to board and care, skilled nursing facilities, and institutions of mental disease, Department of State hospital eligible beds, and will continue to optimize value through acute care rates. We also plan to expand services to unserved and underserved populations with behavioral health conditions, including new substance use disorder residential resources, enhancements to our LGBTQ+ youth program, Our Safe Place, which offers mental health services and drop-in centers for LGBTQ+ youth up to age 21 and their families, and enhancements to our program that addresses the commercial sexual exploitation of children. Additionally, in partnership with county school districts, the new Screening to Care program will begin school-based screening for middle school youth. With initial funding from the American Rescue Plan, services will use a multi-tiered approach, which includes universal screening of students regardless of the child's insurance status. This will complement the enhancements to the School Link program, which provides school-based outpatient services across the region. For individuals with justice involvement, we'll be offering a pro-Lee assertive community treatment program, expansion of behavioral health court, and expansion of the sobering services program. To support individuals experiencing homelessness, the new Nexus shelter and new recuperative care resources will support individuals within the city of San Diego who are homeless and have a chronic substance use disorder. Behavioral Health Services continues to recalibrate its organizational structure to align with similarly sized healthcare organizations with the goal of establishing infrastructure and workforce positioned to deliver excellent quality services through county-operated and contracted programs. This includes aligning behavioral health services operations with agency functions to ensure robust support within communications and community engagement, finance, San Diego AIM, information technology and data systems management, contracts management, and project management. Restructuring the department will further support thoughtful clinical design, integrated data that drives meaningful outcomes, a population health approach, a better customer experience, and financial sustainability. We wanted to highlight a few key op plan metrics as follows. Mobile crisis response team diversions from a higher level of care. This is a newer metric that was added in fiscal year 21-22 and reflects an important goal of the service. We continue to successfully divert individuals from hospitalization through our regionally distributed crisis stabilization units. For the next fiscal year, this metric was removed as we collect data to establish a new baseline that will inform the development of a new metric more aligned with improved client care. Our county-operated psychiatric hospital continues to ensure patients aren't readmitted within 30 days, demonstrating effectiveness in keeping people out of a revolving door back into inpatient care. And we're ensuring individuals seeking outpatient substance use treatment are offered an appointment within the 10-day timeliness standard. And lastly, we are ensuring access to help for individuals who are experiencing a crisis or in need of services by ensuring calls to the Access and Crisis Line are answered within an average of 60 seconds. As we look at this overview of the Behavioral Health Services budget, you can see we have an increase of $71.8 million and a net increase of 94 FTEs. With the funding increases spread across mental health services, inpatient services, administration, and substance use disorder services. Behavioral Health Services is requesting 52 new FTEs within county-operated direct services to expand case management and outpatient services in alignment with the clinical redesign that we conducted with contracted biopsychosocial rehabilitation services, along with adding additional staff within the San Diego County Psychiatric Hospital in Edgemoor to support environmental services functions to reduce reliance on temporary staff. Requesting 12 new direct services FTEs to support youth with probation involvement, and 51 new administrative services FTEs to support Behavioral Health Services' role as a health plan and provide clinical and administrative oversight and management of direct and contracted services. These FTEs lead and support work within harm reduction, crisis services, homelessness and housing, children's outpatient services, care coordination services, data science, finance, workforce development, contracting support, information systems, and project management. As you may note, there was also an adjustment of 4 FTEs. Oh, I'm so sorry. I meant to mention also quality improvement as one of the key tasks of our administrative FTE. As you may note, there was also an adjustment of 4 FTEs out of alcohol and other drug services, which is attributed to staff who were previously 100% supporting substance use disorder services, but are now supporting broader work across substance use disorder services and mental health services. So they were shifted to mental health administration. We've outlined more details on specific budget increases on this next slide. Some of our significant budget adjustments include an increase of $28.1 million for behavioral health treatment services for adults, children, youth, and families to help address identified ongoing unmet behavioral health needs in the county. We're also adding $11.7 million to expand and enhance long-term care capacity and acute inpatient bed day rates. An increase of $7.6 million for the continued phased implementation of mobile crisis response teams throughout the county and enhancements to crisis residential services. And an increase of $7.5 million for the first year of the school-based screening to care program, beginning with middle school students funded under the ARPA framework. Finally, we're investing $7.4 million to make additional investments to modernize data integration and electronic health records. Behavioral Health Services is well aligned with the county strategic plan. Our sustainability goals are broken down into 3 categories. Short-term goals include supporting countywide efforts to operationalize facility sustainability policies and procedures within county-owned and leased facilities, coordinating with contracted providers to implement sustainability policies and procedures, and supporting remote working for employees when possible to reduce the departmental footprint and vehicle emissions. Midterm goals include improving sustainability by encouraging contractors to evaluate the use of electronic vehicles with contracted programs when procuring or leasing new vehicles. And finally, our long-term goal is to partner with the Department of General Services to explore sustainable design and construction of new behavioral health services capital projects, including the 3rd Avenue Hub, East Regional Crisis Stabilization Unit, and the Edgemore Acute Psychiatric Unit. Under the equity strategy, we continue to enhance regionally distributed services to reduce health disparities and ensure equitable access to care for all people with behavioral health conditions. Some notable enhancements include an increase for substance use disorder, residential, and withdrawal management services, and strength-based case management with a transition age youth component for the North County, and an increased mental health services for youth with high acuity needs in foster home settings. To support the Empower strategy, Behavioral Health Services is committed to investing in a skilled behavioral health workforce and infrastructure in order to support the delivery of exceptional services. We will continue to work with the San Diego Workforce Partnership on short, mid, and long-term strategies to address current behavioral health workforce challenges. To support the community strategy, we'll continue to facilitate meaningful community engagement with stakeholders, including in established venues such as our Behavioral Health Advisory Board, Adult and Transition Age Youth Councils, and contractor associations. We'll also advance our work on the Community Experience Project and our Behavioral Health Equity Index. We will continue moving forward key community engagement efforts, including those related to our harm reduction strategy, Tri-City Psychiatric Health Facility, our 3rd Avenue Behavioral Health Hub, and the East Region Crisis Stabilization Unit, along with public messaging for mobile crisis response teams, youth fentanyl education, and community naloxone distribution. In collaboration with public safety partners and HHSA's Medical Care Services Department, Behavioral Health Services continues to enhance services for individuals with behavioral health conditions who have justice involvement. This includes supporting medication-assisted treatment services in county jails, along with care coordination services, supporting the transition to the youth in custody practice model for young people in juvenile detention, and planning for the enhancement of sobering services to serve higher acuity clients, including those with methamphetamine and polysubstance use, and providing successful care transitions. Now, pending questions, this concludes my presentation. Thank you.
Thank you, Dr. Bergman. I think your department has probably seen the largest increases of any over the last few years throughout our county, and I think we've thrown a whole lot at you, along with really fast expectations of getting things done, and so kind of commend you and the team. 2 quick questions. MCRT, obviously the vast majority of those have come in through the access and crisis line, which is what we want. But with now all law enforcement agencies being able to divert 911 calls, we don't really know what the volume increase may or may not be, and they're not all doing it the same. There's going to be some learning lessons. I guess my question is, do you think you have the funding in here for MCRT that if we see a pretty significant increase in the demand on the service, do we have the flexibility and ability to ramp up to meet that need?
Yeah, so the request in this budget reflects our best projections for how this service will grow. Okay. We do anticipate that it's going to grow, and it is a difficult thing to estimate. There's also, of course, 988 being introduced very soon, which will also have an impact on sort of the broader socialization of the service and its accessibility. We hope, over many out years that it will become, a kind of ubiquitous part of our continuum landscape. For the near term, we think this budget reflects a good projection about what we'll need.
If we, and again, we can't know. I mean, we just don't know what the demand will be. And so if our projections are on the low end and the demand is outstripping our ability, please come back to the board, and maybe one of those things we have to mid-year adjust to be able to meet the need. When does 988 come online? Do we know?
July. Okay.
Of this year?
Yeah.
So that would essentially replace the access and crisis line?
It would be, I would say, a complement to it. I think we wouldn't expect, an abrupt and categorical replacement. We've spent so long socializing the access and crisis line.
Right.
I think every member of this Board of Supervisors has contributed to that. We wouldn't expect it to be sudden, but over time.
But the new effort would be around calling 988.
We want to emphasize that, obviously. I mean, it's easy to remember.
Easy to remember. I know we have another CSU coming online in East County in the planning process. Does that meet our regional need, or do we need more?
It's a thing that we're going to have to keep our eyes on, right? It's, CSUs are part of a complex, kind of ecosystem that we're developing, kind of on the crisis and diversionary front. I would say that what we're seeing in the CSUs thus far reflects a great deal of success. These services are I think, appreciated and applauded by the healthcare community, by the behavioral healthcare community, and by law enforcement communities as well. So we are, kind of eager to see how need and demand kind of take shape around the expanding network of CSUs. It'll be a thing we continue to study.
Got it. And then last point is just around the harm reduction efforts. I think those are important. I know there's still, we fundamentally as a board changed our entire county policy posture as it relates to harm reduction. We know that can be the single most effective thing, not just for opioids and fentanyl, but for all of the issues that we face. And I think our continued efforts to really drive implementation on those and think about those efforts as we continue our rigorous planning underway for opioid settlement dollars and how we will invest those to tackle those is going to be important. And then the last thing is just ensuring we have adequate staffing to be able to go access state funds. We know there's considerable funding coming down around behavioral health workforce and other types of things, and making sure we're leveraging everything we can do to get proposals in, get requests in, and do things like that. So, good. Supervisor Lawson-Remer.
To be honest, you said most of it was on my mind, so just to double to my colleague Chair Fletcher's comments, just to add to that, obviously you are doing amazing work that's so vital for everything we're trying to do for San Diego County, and really a linchpin of that effort. But of course, the linchpin of the linchpin are the folks who are on the front lines and the workers, the staff. So I think just would appreciate you keeping us up to date around challenges around recruitment and retention and staffing to make all these programs actually happen, and thinking together about what we need to do and if we're going to need any budget adjustments as we move forward to make sure we're staffed appropriately. So thank you.
Thank you, Supervisor.
Vice Chair Vargas.
I just wanted to say thank you for all the great work, and I'm really looking forward to the middle schoolers program particularly, and then getting additional information on what other resources you're going to need. So I know that funding is already allocated, and I know the governor has a lot of funding in the behavioral health, particularly for youth, but that prevention piece for me is I'm very interested, especially because we don't know the impacts of COVID, and I know that we've had long conversations about that and what that looks like in terms of our youth. And so really just, I think, to reemphasize what the chair has mentioned, for me that's extremely important. But then also, want to check in with you around the issue of the equity lens. And when it comes to behavioral health, I know it wasn't part of the questions, but stigma is such a huge issue in our communities, and I don't know if there's additional funding and as part of communications in terms of how we're engaging communities and communities of color and underserved communities, particularly around how we're going to share this information. I know you and I have had some conversations about particularly the program with the middle schoolers, and I just want to make sure that those dollars are in there and what that looks like, and how else can we help in that process.
I appreciate that, Vice Chair. So, I mentioned that the next phase of the MCRT campaign, for example, will really focus on messages tailored to specific communities. So really sort of taking account of how behavioral health issues are culturally constructed differently in different settings, driven very much by sort of the different valences of stigma. And I think just to your point, stigma is a key facet of addressing equity, sort of the mechanics of addressing equity. This is something that, kind of one of the vocabularies that we've introduced is around the importance of understanding need and not just demand, right? Not just sort of serving the people who are getting access to institutions that provide care, but understanding that so many folks who need care are never accessing care, and in some cases owing largely to the profundity of social stigma around these conditions. So yeah, I think the nexus of communications and really understanding need, which is going to be sort of a key antecedent to addressing equity, is critical.
Thank you.
Chair Fletcher, members of the board, as you heard from our department directors, our agency has made and continues to make strong investments in addressing the priorities of the community and your board. Along with these investments, vital to achieving our goals are our highly talented workforce of the agency, 7,200 strong, along with our community partners and volunteers. Enhancements in information technology and robust data collection and insights. Our culturally responsive community engagement guided by a health equity lens. Strengthening existing and building new partnerships for progress, and leveraging and pursuing new funding opportunities. The agency is fully engaged in helping communities thrive, not just today, but also by looking ahead and making plans for a sustainable future. Our departments are developing individual sustainability plans, each with strategies to protect future generations' abilities to thrive. Future endeavors include expanding the agency's electric fleet and maturing our models that incorporate remote working. In fact, in calendar year 2021, the Health and Human Services Agency staff in total saved over 26 million vehicle miles driven as a result of teleworking. This equates to a reduction of 7,700 metric tons of carbon dioxide. And we did all of this while improving the satisfaction of the people we were serving remotely. Lastly, you may have noticed, rather than being specific to a single department, these priorities are grounded in our interconnectedness across the entire agency and, in fact, our county enterprise. This approach ensures, as a county of one, we take a whole person-centered approach to the health equity work we do. For example, we've been enhancing our work with our county's public safety group partners that's been mentioning, including our district attorney, sheriff, public defender, probation, and superior court, regarding alternatives to incarceration, justice-involved behavioral health in our county jails and our youth transition center, protecting our vulnerable children and seniors, as well as addressing the prevention and treatment of methamphetamine and fentanyl, which includes our emerging harm reduction work. The complete alignment between our county departments of general services and planning development services and our housing and community services has led to new affordable housing projects, as you heard, countywide, with an aggressive goal of achieving nearly 3,400 affordable housing units within the next 4 years that will help serve over 35,000 San Diegans who are experiencing some of life's most greatest challenges facing poverty, health disparities, and homelessness. Another illustration of our County of One approach is our integrated partnership between our agency public health services with the Land Use and Environment Group in developing the county's climate action plan, including updating the environmental justice and safety elements of the general plan. We're also advancing the innovation and future work of our food systems to ensure vulnerable San Diegans have access to nutritious foods while building a sustainable food system. And as we look ahead, one of the lessons confirmed is that at the heart of the success for the entire region is the people who work in our agency and our county, our community residents, and partners and volunteers. It is these individuals who collectively contribute to and create a region that's truly making a positive difference in the daily lives of San Diegans. By channeling the power of working together and uniting our expertise and resources with the community and our partners, we can proactively fill in the gaps in order to improve resiliency, strengthen communities, and very importantly, lift up and support residents so they may be self-sufficient and lead their own way to a better life. All toward achieving a vision of a region that's building better health, living safely and thriving to advance a just, sustainable, and resilient future for all. This concludes our agency presentation, subject to your questions. Thank you.
Thank you. Let me ask Clerk if we have any public speakers.
Thank you, Chair Fletcher. We have 2 requests, both by phone. Those members of the public that requested to speak on this item by phone, please dial into the conference line now using the instructions provided to you. When it's your turn to speak, you will be unmuted. You will hear a recording that will tell you to begin your comments after the beep. I would remind callers that they should mute their TV or live video stream before they begin speaking. Andrew?
Thank you. We'll begin with our first caller.
It's truth. For HHSA, the general management system, like everything else, has been reimagined for, quote, building our future, a future that is just, sustainable, and resilient, and straight out of the Rockefeller Resilient Cities Network Plan. And we'll have to hear Nathan repeat that cult mantra every chance he gets. For behavioral health, Nothing could be a more nefarious way to spend our money than tracking and testing the mental health of children while in school without parental consent as part of the Screening to Care initiative. For housing, a total of $21 million will be spent for things like an eviction prevention program for the homeless. A great example of our dollars being put to destructive works is the Home Key program, where the supervisors decided that 41 permanent homeless housing units will be shoved into the $1 million El Cerrito neighborhood. It was once ranked as the hottest neighborhood in the nation, but now it's destined for permanent degradation. Or to add KO. And speaking of chaos and destruction, we move on to public health. There will be 73 new public health positions. How many more contagious Wootens and Faucis will be released onto the public? Wilma has failed every year in her role with twisted statistics unworthy of any degree. The supervisors have shown that they have no problem with crazy charts that last week literally said that there's a 100% increase in deaths because there was one single death. And all of that somehow justifies this eternal emergency because money. A total of $653.5 million of ARPA funding. The attached plan says we're transitioning, quote, into a new phase of the pandemic. It's a wave we're expected to keep riding, but I see nothing but holes in the boat, Wilma Wonka.
Thank you. And Chair Fletcher, that concludes the request to speak by phone at this time.
Wonderful. Thank you all. We will take a 5-minute break to recess, and then we will get into FG3 presentation. Thanks, everyone.
pass.
Welcome everyone back. I will turn it over to Ebony.
Thank you. The final group today to present to you is the Finance and General Government Group. The departments in the Finance and General Government Group provide critical support and infrastructure that form the backbone of the county. While it's not always visible to the public, these services are no less important in ensuring our ability to function and serve our communities. Some of the activities that readily come to mind in FG3 include services like human resources, financing and budgeting and technology and counsel, but we're also responsible for administering the property tax system, media relations and emergency communications, the execution of our large capital program and management of our fleet, oversight of over 2,600 contracts with an annual spend of $2 billion, investments in banking, including the county's $14.4 billion investment pool, coordination of unemployment and workers' compensation benefits, conducting elections, investigating misconduct of sworn officers, and maintaining vital records, including birth, death, and marriage certificates. FG3 plays a vital role in the background of our residents' lives, as well as support services to the rest of the organization. This slide shows the 17 FG3 departments, including important offices that are embedded within the Chief Administrative Office and the FG3 Executive Office. Under your board's direction, we're looking forward to building the new Office of Economic Development and Governmental Affairs in the coming year. Over the past year, FG3 has made it a priority to apply an equity and belonging lens in the design and implementation of everything that we do. We led the enterprise effort to refresh the county's mission, vision, and values to reflect our new direction and inclusive approach to governing. The general management system was reimagined to place community engagement at the center of all operations while maintaining the integrity of our core management principles. The budget that's been presented to you today is the product of the county's first ever budget equity assessment tool and process, and this tool has helped us better understand how resource allocation decisions impact Black, Indigenous, and people of color, and low-income and other historically underrepresented communities. We will continue to refine this process to help departments critically analyze budget decisions and inform future resource allocation strategies that reduce inequality and improve outcomes for all. The Finance and General Government Group also established the Office of Labor Standards and Enforcement, which will protect vulnerable workers from unscrupulous employers and enforce ordinances such as the Working Families Ordinance. All of our incredible work would be for nothing if we didn't secure a sustainable future for our future generations. The Finance and General Government Group is making sure that the county reduces its facility energy use and greenhouse gas emissions by maximizing opportunities to implement renewable energy sources whenever it's feasible. And finally, the Finance and General Government Group has completed a nationwide recruitment for the county's first ever Chief Evaluation Officer. The Chief Evaluation Officer will implement enterprise-wide strategies and performance analytics to ensure evidence-based policymaking is fully embedded in county operations and program design. The fiscal year 22-23 brings a fresh outlook and new opportunities in community engagement and collaboration. Our group will develop a community engagement strategy led by a new community engagement manager who will provide central coordination and support to all county departments. The Office of Economic Development and Government Affairs will position the county as a regional leader in driving inclusive economic growth and community development. And it will also foster new opportunities in arts and culture in collaboration with community advocates. The Finance and General Government Group will also increase access and transparency to resources and information. The Digital Services Program will improve our web-based resources by enhancing searchability, implementing a multilingual framework, and improving the overall user experience. And a new Public Records Act unit will coordinate all PRA requests and streamline the process for members of the public who are seeking records and other information. This next part of the presentation will highlight the Finance and General Government Group's fiscal year 2022-23 recommended budget and its significant changes. Overall, the budget for this group is increasing by $17.2 million. If you focus on the far right column on this table, you'll see that the primary drivers include investments by the Registrar of Voters to implement the Vote Center model, and additional staff in County Council and Human Resources to support the growing needs of departments and programs, expansion of the Board of Supervisors, district offices, new positions in the County Communications Office to support community engagement and language access services, and the establishment of the Office of Economic Development and Government Affairs and the Public Records Act unit under the FG3 Executive Office and Clerk of the Board, respectively. Offsetting the overall increases are decreases due to the removal of one-time costs associated with the establishment of the Office of Equity and Racial Justice in the Chief Administrative Office, the increased use of central funding from countywide finance other for various IT projects that are managed by the County Technology Office, and the removal of one-time costs for IT projects in the Auditor and Controller's Office, and the transition of record services in the Purchasing and Contracting Department from general purpose revenue to the Purchasing Internal Service Fund. FG3 also has $3.5 million of ARPA funds budgeted for fiscal year 22-23, which are embedded in the departmental budget totals that are shown here. Of the $3.5 million, there's $2 million that will be used for data evaluation of ARPA-funded programs and services in the Office of Evaluation, Performance, and Analytics. $1 million is allocated to the Auditor and Controller for processing and review of ARPA claims, and $250,000 will fund ongoing COVID-19 testing for county employees by our Department of Human Resources. $200,000 is allocated for the administration of the Small Business Stimulus Grants Program under the Finance and General Government Group Executive Office. And finally, we have another $1 million that's allocated in the capital program to begin the Food Access Initiative Community Gardens, which you'll hear about a little later today. On the next slide here, we highlight the budget changes that are outside of the general fund and in our internal service funds. These funds provide an accounting mechanism to track and manage costs for services that are provided to our internal departments, such as facilities management, fleet maintenance, information technology, and purchasing and contracting. These funds represent $462 million of our total budget, and here you can see that they're increasing by about $5 million. The increase is being driven primarily by planned projects to modernize facilities and an anticipated increase in procurement activities, which is offset by decreases in one-time funding and IT technology spending. The next slide here outlines the group's most significant general fund budget changes and the major allocations of general purpose revenue. As noted previously, the significant investments that are being made are to implement the vote center model, to expand staffing in multiple departments, including County Council, the Board of Supervisors, and Human Resources, as well as the establishment of the Office of Economic Development and Government Affairs, and to continue implementation of the Digital Services Program, the new PRA unit, and to provide central coordination of community engagement and translation services. But it also will address workload needs in the assessor recorder county clerk's office. General purpose revenue was allocated across multiple departments in anticipation of increases in salary and benefits across all classifications. We'll also, excuse me. And now I'd like to take the opportunity to talk about county-wide expenses. In the operational plan, you'll find these budgeted under Finance Other. Finance Other includes programs that impact the entire county, rather than one specific department. There are no staff in Finance Other, and the responsibility for managing these funds rests primarily with the Finance and General Government Group. The proposed decrease of $56 million next year in Finance Other is primarily due to a decrease in new capital development or land acquisition projects under the capital program. This is offset by increases in our public liability internal service fund or tort liability fund, as well as countywide general expenses, which include amounts that are set aside for future labor cost, countywide technology cost, and one-time support for various programs. I'll wrap up the overview of the Finance and General Government Group with a brief discussion on how we align to the new strategic plan and initiatives. FG3 will continue to lead efforts to make county facilities greener and more sustainable, including expanding our electric vehicle infrastructure, increasing use of renewable energy, and achieving net zero carbon emissions where possible. We'll also support the Equity Strategic Initiative by refining the budget equity assessment tool and building on its first implementation and lessons learned, and leading the charge in protecting vulnerable workers and continue to provide recommendations to reduce the likelihood of racially disparate law enforcement practices. In the category of Empower, FG3 will lay the groundwork to advance evidence-based policymaking throughout the county by empowering leadership and your board with the performance analytics and the evaluation tools necessary to advance data-driven decision-making. We'll also engage our communities in a myriad of opportunities in economic development, in arts and culture, and inspire greater civic engagement through a more accessible election process. And finally, FG3 will support the development of the county's social equity program for commercial cannabis in alignment with the Justice Strategic Initiative. New investments and important initiatives that support the strategic plan such as these will be highlighted throughout the upcoming department presentations here today. Subject to any questions that you might have, this concludes the group overview. If you have no questions, I'll turn over the presentation to Paul Parker, the Executive Director of the Citizens Law Enforcement Review Board.
Thank you, Ebony, and good afternoon, Chair Fletcher, Vice Chair Vargas, and Supervisors Lawson, Reamer, and Desmond. Thank you for this opportunity to present CLERB's operational plan, as I believe that the more folks that know about us, actually know about us and what we do, the better services and the better and more relevant and appropriate services we can provide. So the Citizens Law Enforcement Review Board, also known as CLERB, conducts independent, thorough, and timely and impartial investigations. We've been around for 31 years, and over the last year is probably the most proactive we've been in looking at complaints of misconduct concerning only the sworn members of the Sheriff's and Probation Department, deaths related to the activities of sworn members of those departments, any discharge of firearm, any use of force resulting in great bodily injury, and any use of force at protest or other First Amendment protected events, the last three of which were given to us or expanded our jurisdiction last year based on the actions of this board, and we thank you for that because that's resulted in 21 additional investigations and, for us to look at. We are mandated to conduct the inspections of adult detention facilities. We've never done it. We've had the authority to do it for 30 years. We've never done it. We're going to do it for the first time this year. We also make policy and procedure recommendations to the sheriff, to the chief probation officer, and ironically enough, to the Board of Supervisors. We've never done it to the Board of Supervisors. We do it to the sheriff. We do it to the chief probation officer. But we'd like to start moving forward and doing that this year. We're advisory only. We need to say that. There's nothing that we do that is mandated for any of the departments to do. We're advocates for the facts. We're certainly not advocates for the departments, but we're not advocates for our complainants or for the county either. If we had a vision statement, it would be to improve and ensure just and equitable law enforcement and detention services provided by the Sheriff's Department and Probation Department. As far as our highlights over the last year, we've had many accomplishments, and I think anybody in this room would say that we were actually more proactive and relevant and communicative than ever. We're kind of out of the shadows now, and that's thanks to this board, to this Chief Administrative Officer, to this Finance and General Government Group, DCAO, and our CLERB board. All of our investigations of complaints, death, and other incidents were completed on time. If you followed CLERB over the years, you know that that hasn't been the case. That has not been the case. And I can assure all of you that if we time out any cases, and I'm going to say this in public, I will resign. There's no excuse for it. That's our dedication to getting these cases done timely. We processed all of our new complaints within 2 days, which was an issue we've had in the past. We made 12 policy and procedure recommendations last year. I believe the policy and procedure recommendations we'll talk a little bit more about are the foundation of what we do at this point in time because it starts a dialogue. It starts a dialogue. I believe it to be so important that we made 14 in April of this year alone. We also continue to provide our monthly early warning reports to the Sheriff and Probation Department. We finally have also prioritized all death cases, all death investigations, which is what it should have been for years. So we're looking forward. Some of it I've already touched on, but we're going to continue to do our community outreach, right? I've met with many city councils. I've met with many community groups. I've attended many town halls. We've hosted our own town halls, met with the Human Relations Commission. You name it, I'm going to go. I'm going to get the word out about what we do. But more importantly, so I can talk to the community and find out what they want us to do, what we should be doing. So again, we'll continue about the policy and procedure recommendations as we've talked about. But the two main topics that are facing us, because I believe the two main topics facing the Sheriff's Department specifically are the deaths in custody and racially disparate, allegations of racially disparate policing. So in reference to those deaths in custody, we conducted our own independent analysis in addition to what the state audit came up with, presented that to the department, and thus far they've been responsive. We have made numerous policy recommendations about deaths. The Sheriff's Department has entered into an MOU with us to allow me to respond to any death scene. That's unheard of. They did it. We're working on improving that MOU right now to provide a little bit better access. We've made policy recommendations as recently as that last month. I heard it talked about fentanyl earlier today. It's obviously a huge issue. And because of that, the Sheriff's Department has one fentanyl dog. I got to meet that dog, and they're updating their policies and procedures, but obviously, I'm not here to advocate for the Sheriff's Department, but more dogs, the better. More body scanners, the better. We've made policy recommendations to scan as many people as possible. It may not be able to happen, though, for funding and staffing purposes. So with that being the case, despite everything the department is doing, people are still dying of drug-related deaths, and we're here to make these recommendations. We made recommendations for the use of technology to monitor the staff, to monitor the inmates, the health of inmates in the Sheriff's Department facilities. We made recommendations to increase the communication with the families, with those members of the public who are impacted by these deaths. We've made recommendations to stop sealing of cases, to increase their security check protocols. All of these things related to the audit. And thus far, the department, to its credit, has been responsive to us. Finally, as far as what we're looking to do, racially disparate law enforcement practices. There have been several reports that have indicated that perhaps there are racially disparate practices. We were going to provide a plan for the department to eliminate those practices. And we've done that. We made 5 recommendations to the department to include the reduction of discretionary stops or contacts pertaining to low-level offenses that don't compromise public safety. Review body-worn camera footage to discern whether there's a difference between the way white folks are contacted and persons of color are contacted. To look at all discretionary decisions to make sure that they're evaluated for whether they're going to result in racially disparate treatment. To eliminate motor vehicle pursuits of nonviolent felons. All of these things we have presented to the department because we believe that the deaths in custody and the racially disparate allegations are front and center right now. And we believe we can play a role in helping the department to improve those services if there's an improvement needed. As far as our key performance measures, we don't have measures on how many cases we're going to get a year. That's dependent upon our outreach right now and the activities going on within the jails and the patrol services. I will say we're on pace right now to have a 23% increase in the number of cases this year over last year. As far as the deaths, we all know that that's an issue. Our performance measures are to complete those cases within that time frame and knock it down to within 3 months of us receiving all investigatory materials. Next slide, please. We're obviously funded by general purpose revenue, and we're only requesting an increase of $100,000 this year for one position at this point, and that's an administrative analyst position. We talk a little bit about the data that we have. We need to look at the data we have, and we need to analyze it and get it out to the community. Other civilian oversight entities within the state are staffed much more, and their budgets are much higher than ours for doing the exact same work. Many of the departments, their budget is actually a percentage of the departments that they oversee. Ours is not, of course. But I'll continue to assess once we're fully staffed. We have one investigator opening right now out of the 6, and we're still looking at expanding and exploring the potential to expand our jurisdiction to include anybody that provides medical and mental health care to folks in the Sheriff's Department and Probation Department's custody. Finally, we'll continue our outreach and scene investigation thoroughness, and then meet the complainants where they are, as opposed to dealing with them via email and the phone. Go to the jails, go to their homes, meet them where they are, and get the information so we can do our investigations. As far as our alignment to the strategic plan, look, I mean, we're teleworking. Anybody that can telework, anyone is able to telework, teleworks. We're still doing our hybrid meetings. We're still doing virtual right now, but we look to do hybrid when we go back to meeting in person. Obviously, with equity, we're the overall trends in deaths in custody. We have the data for what the ethnicity is of folks that are dying, the ages of folks that are dying, the sentence level or not of folks that are dying. These are things that we need to look at. And as far as empowerment, we plan to maintain a transparent and independent oversight process whenever possible. Look to expand to support the increase in transparency in the civilian oversight process. As far as the community alignment, obviously, I've been out in the community. Anybody, I mean, we're going to continue to do that. I want to hear from the community, and that the budget equity tool has helped us to do that, to focus on that, to get that community feedback, community input. So obviously the justice we've already talked about. I'm not going to go over all of that, but it's basically everything I just said about racially disparate treatment, deaths, completing our investigations. So with that, absent any questions, this will conclude my presentation.
Thank you, Paul. Quick question for you. One, I think the overall direction of CLERB is very positive. And under your leadership and with what's happening. And I think the cooperation with the Sheriff's Department is appreciated, and I think it's good. I think the jail inspections, the investigations, just doing things you've had the authority to do in the past that haven't been done is good. And I think you rightfully recognize, and I appreciate this, that doing the investigations on time is the expectation. And so it is, we commend it because in the past it hasn't always been that way, but that's just what's expected. And I think you set that right tone. I know you have brought up in the past the need to add civilian Sheriff's Department staff to your purview, particularly in jail settings, and I've committed to working with you to make sure we can get you that authority. Absent that one change, which we will get done, and I'm committed to working with you to get you that change, are there other things you need from a policy standpoint this board could do for you to be able to properly do your job? Or do you feel like you're equipped today to be able to fulfill the mission of CLERB?
Thank you, Chair Fletcher. I'm equipped at this moment. Okay. I'm analyzing a report that has 70 areas of improvement that have been recommended to us, and I'm going to talk about it at our next CLERB meeting. Okay. I will come back. I'll work with Ebony and come back at that point.
Okay, perfect. Second is, do you have adequate staffing to be able to fulfill your investigatory responsibilities?
At this point, once we become fully staffed, I'll be able to make a better determination. I believe so, but if the expansion expands to that medical, absolutely not.
Okay. And if that's the case and you don't, then I need you to let us know so we can properly staff you to do your job. And then third question is, do you have the freedom and authority to go out and speak freely about your work and what you do without interference?
There is absolutely no one who stopped me. Absolutely.
Okay, perfect. You know, I ask you those same 3 questions every time.
Yes, you do.
So I just want to make sure.
Thank you.
And if the answer to those is ever no, then we expect you to come back and tell us so we can equip you to properly do your job.
Thank you, Chair Fletcher.
Thank you. Supervisor Desmond.
Thank you, Chair, and thank you very much for the candid and blunt presentation. I appreciate that, and I do think it'd be a great idea if you report, whatever, every 6 months or something. You come to the Board of Supervisors, tell us what what successes, challenges, and things like that. We'd be very interested in hearing.
Thank you, sir.
I would be. So thank you.
Thank you.
Vice Chair Vargas.
Thank you so much for that, and thank you for all the great work. Can you talk a little bit more about the equity tool piece that you mentioned, that you were able to engage the community a little bit more?
Sure. We opened up our forum in reference to, we realized basically because of the equity tool and listening to the community, that there were concerns about the racial disparity, things that racial allegations, racial discrimination. So we opened up for 2 months to hear them, how can we do a better job in investigating these allegations? And we did that at the end of last year when we started talking about all this. So that was very helpful to kind of get us to that point where we just made that plan to help them to reduce racially disparate practices. So I have talked about that with the community, have received some feedback. Next year, now that I'm more have my feet under me, we'll do a better job of that, get more out in front of the community with that. But it has helped me with our investigations outreach. Again, the racial disparity, the deaths in custody, but more importantly, Vice Chair Vargas, it has allowed me to realize we have data, and we're just not doing anything with it, to be honest. And so that's really where it's helping me moving forward.
Thank you. I appreciate that. And I think I have to just say it for the record, right, that desegregation of the data is the piece that's really important. And what we do with the data is sort of that next step. So I appreciate and the engagement of the community for me is extremely important. So as Chair Fletcher said, let us know what else we can do. And I appreciate it. Thank you.
Thank you.
Thank you, Paul.
Next up, we have Caroline Smith, the Director of the Office of Economic Development and Governmental Affairs.
Thanks, Ebony. Good afternoon, Chair Fletcher and members of the board. I'm excited to present to you today the budget for the newly created Office of Economic Development and Government Affairs. Under your board's direction, the county's roles in legislative advocacy, economic development, and arts and culture have been expanded and reimagined, and this office will be carrying out that vision. The Office of Economic Development and Government Affairs, or EDGA, will continue to manage the board's legislative program and advocacy and all duties currently encompassed in the Office of Strategy and Intergovernmental Affairs, or OSIA. In addition, this office will oversee the roles of economic development and prosperity and arts and culture. Furthermore, the public-facing grants, such as neighborhood reinvestment and community enhancement, which currently operate out of other departments within the county, will be consolidated under this office. And finally, this office will now provide a central grants tracking function for all external grants coming into the county, which is currently a task not performed by any department. EDGA will cover the 5 functions you see listed here. As mentioned, we'll continue on with the legislative and budget advocacy and legislative tracking currently done by OSIA. Economic development and prosperity will be implemented as outlined in the April 1st, 2022 board memo, which includes the creation of a Regional Comprehensive Economic Development Strategy, or CEDS. We'll develop and grow relationships with regional economic development partners, work to remove barriers for small and non-traditional businesses to diversify the business community, and create a mechanism that encompasses the entire region, not just geographic sections. The Neighborhood Reinvestment and Community Enhancement Grants Program will be transferred here rather than housed in the Office of Financial Planning and with the Auditor and Controller. This will provide a one-stop shop for your offices as you direct the spending of these grants, and also creates a synergy with existing and future duties of the other units of this office. In addition, the creation of an external grants tracking component is something that has been requested by both the board offices and our county departments. Having a central repository to track opportunities, applications, and successful awards will help provide important data to our departments as they apply for future grant opportunities. As detailed in the memo to your board on November 10th, 2021, this office will also oversee the expansion of the county's role in arts and culture. This includes consolidating and advancing current efforts, promoting opportunities to expand equity and access, and providing staff support to regional efforts. And finally, strategic planning. On January 11th of this year, your board approved the county's new vision, mission, values, and strategic initiatives. In conjunction with the Chief Administrative Office, we are in the process of implementing these as well as the reimagined general management system, enterprise-wide through a team of ambassadors focused on employee engagement. As we transition from the functions of OSIA to EDGA, some of the highlights of last year's accomplishments are taking positions on 59 pieces of legislation, 15 of those specific to equity and justice. 2021 was our first year operating under the new format of the legislative program as outlined in the Framework for the Future, which provides more proactive direction for advocacy than in the past. This is in contrast to 2020, where we had positions on 16 bills, and in 2019, where we took positions on approximately 45. One additional highlight was the successful passage of Assembly Bill 636, the county sponsorship effort from last year, authored by Assemblymember Mainshine and signed by the governor on October 5th. AB 636 protects vulnerable older adults in our community from being the victims of appalling living conditions at the hands of unlicensed independent living facilities. In addition, as mentioned, this past year, the county's governance documents were revised and reimagined, resulting in approval from your board in January. As we look toward the future, the legislative team has several key items they will focus on in DC and Sacramento, and there will obviously be a heavy focus on standing up the new components of the office and completing the SEDS. We have 2 performance metrics from the legislative function listed here, with more to be added as the other units are created and staffed. Our sponsorship proposals are focused on quality and not quantity, and this measure reflects how important it is to have meaningful policies signed into law. A new focus of the legislative program, in line with the strategic plan and in conjunction with the Leon Williams Human Relations Commission, we've been focusing on efforts that support legislation tied to equity and justice. So far this combined legislative session, with 1 year of the new legislative program under our belt, we have 15 bills that we support in this effort, which exceeded our goal of 10. The total budgeted amount for this office is $3.6 million, with 16.5 full-time employees that will be divided into 2 units with 8 employees each. This encompasses 10 current county employees, 5 in the legislative unit, which includes the federal affairs position added by the board in the last fiscal year, as well as the 5 current employees working on grant programs in the Office of Financial Planning at Auditor and Controller. It also adds 6 full-time positions to fulfill the roles needed to implement the economic development, arts and culture, external grants tracking, and administrative support functions to assist both units. We are proud that EDGA will be advancing goals in all areas of the county's new strategic initiatives. Just a few examples of these are, for sustainability, to focus legislative advocacy to foster sustainability in all areas, the environment, economy, and services. For equity, we will seek a change in state law that would allow for a mobile pharmacy to dispense medications to vulnerable populations, such as the homeless and those who lack transportation and financial means to obtain medications from a fixed pharmacy location. State Senate Bill 872 by Senator Dodd, it actually just reached the floor of the Senate today, so that effort is underway. In addition, we will continue to provide staff support and subject matter expertise to the Human Relations Commission's Legislative Subcommittee as we continue to advocate for legislation and public policy that supports equity efforts. For Empower, we facilitate the implementation of the reimagined general management system that provides a specific channel of communications for all levels of our organization to provide feedback on our governance documents, as well as any area of improvement our employees have identified. In the area of community, we will establish and strengthen community partnerships and feedback, including participation in regional advocacy roundtables, and establish a stakeholder feedback group for economic development to inform the creation of the SEDS, as well as the establishment of the county's role with respect to arts and culture. We will also be active members of several regional work groups and task forces to better leverage our collective voice with other municipalities and stakeholders in our region. And finally, for justice, to focus advocacy and action on legislative matters pertaining to justice, as well as incorporate economic justice into the regional economic framework. This concludes the information on the EDGA budget information, subject to your questions.
Thank you.
Perfect. I'll now turn it over to Andrew Strong, Director of the Office of Equity and Racial Justice.
Thank you, Caroline. Chair Fletcher, Board of Supervisors. The Office of Equity and Racial Justice conducts outreach and engagement activities with our communities to build trust and create equitable outcomes. We support the Leon Williams Human Relations Commission in its efforts to promote positive human relations. We endeavor to create a cultural responsive organization through training and development, including developing strategies and providing resources to educate on and root out structural and systemic racism in county government. Most importantly, we work with all departments to ensure county operations provide equitable access for all. It is our mission to partner with the community to co-create transformative, enduring, structural, and systemic change in San Diego County government. We bridge San Diego County departments and community voices to design bold policies and practices to advance equity, and we champion belonging for all and advocate for people suffering from structural and systemic racism and exclusion. Over the past year, we've worked to lay a solid foundation for structural and systemic change in county government through building relationships with community to inspire trust and to help co-create a new county government. The following are just a few highlights. Through the development of the Budget Equity Assessment Tool and the rollout of targeted universalism training for our county staff JEDI teams, we've begun implementing practical tools to help county staff look through an equity lens as we develop operational plan and departmental goals and do resource allocation. We began our social equity assessment that will inform the county's social equitable cannabis program, including a program for social equity entrepreneurs. We'll report back in the fall with an update on this program. We've held several community forums to better understand the needs of our communities when it comes to working with eradicating the school-to-prison pipeline and developing programs specifically for boys and men of color. And lastly, we worked diligently to support the county's Leon Williams Human Relations Commission in the development of their strategic plan and assisting them with their 6 subcommittees. The upcoming year will see many of our programs that are in the pipeline begin implementation. As we mentioned previously, we'll report back to the board in the fall with the implementation of the program for cannabis social equity entrepreneurs. We also have several active procurements that will lead to the implementation of several programs, including those that support the Boys and Men of Color Initiative. We've had several listening sessions in preparation for developing the county equity indicators and associated report. We've also entered into a contract with the Workforce Partnership to work with county staff to develop new indicators and facilitate the development of the Equity Impact Report. In the coming weeks, we'll bring a letter to your board outlining our Equity Impact Fund framework and process. And this fund will help small social and racial equity and racial justice organizations by funding their work and assisting with outcome development. Lastly, in response to your board's direction and adoption of the county's CDOT ordinance, we will conduct a countywide gender equity analysis and assist departments in developing gender action plans. Listed on this slide are 2 key performance measures for OERJ. The first one is the number of community engagement activities our office has held this last year. The second measure is the % of budget equity assessment tools that we reviewed and approved. This measure shows that 90 of the 96 assessments that were reviewed were also approved. 6 were only reviewed and not approved due to equity concerns that need to be further explored and mitigated for prior to our office's approval. Our office is also in the final stages of finishing our strategic plan that will include additional outcome-based measures that we plan to include in our next year's operational plan. For the fiscal year 21-22 adopted budget, our office was budgeted 5 FTEs and $1.1 million in operating budget. We are requesting 2 FTEs in this year's budget. The revenue increase is due to this year's staffing requests. The increase of 2 FTEs is to support ongoing OERJ operations and to add a dedicated staff lead to implement the county's cannabis social equity program. To note, we have 7 active procurements in our office that will be funded by existing resources, and $2 million of the existing resources will also be set aside for the Community Equity Impact Fund. The following additional projects show how we are aligning to the county strategic plan. For sustainability, we are supporting the development of the sustainability indicators to be included in the county's equity indicators and associated equity impact report. For equity, we will be developing an equity and racial justice administrative manual policy that will further embed equity and racial justice principles and processes into our county business practices and operations. And for Empower, we are working with our Equity, Diversity, and Inclusion Unit in the Human Resources Department to embed equity, budget equity, and targeted universalism trainings into our academies. For community, we started a partner strategy circle to nurture and build relationships with community-based organizations, partners, and community members in partnership with our equity and racial justice counterparts at the City of San Diego. And lastly, for justice, in partnership with the Public Safety Group Executive Office, our office is leading a procurement for community violence interrupters that will be the first line of response to support communities that experience gun violence due to gang activity. Subject to your questions, this concludes our presentation.
Supervisor Lawson-Remer.
Thank you so much. And I just first want to acknowledge how much work you are doing and your whole team is doing. There's no question that equity is a huge priority, and you're a small, very small and very mighty team that has been leading on, a vast array of initiatives for our entire budget. So thank you for that work, I just really want to make sure that you are appropriately staffed. It seems like a very small team for such a mighty endeavor, and particularly as we begin to engage on, many facets of equity. I know my colleague Supervisor Vargas has really been championing this, including on disability rights, and which are issues that matter very much to me, along with neurodiversity, which you know all about. And so I think that's my really big question is just, as you look at all the facets of equity, are you appropriately staffed, or is this something we might need to revisit as a budget adjustment in the next, sometime in the mid-cycle?
Yeah, and to answer your question, we are expanding, as we talked about in the budget this year. And what I plan to do over the next year is really take a look at that, right, as far as within the 5-year forecast and our planning starting in September this year. Once we get our chief on board, our new position, that's going to be really helping us to look at our performance management, the workload that we have, and the need across the enterprise. Because one of the things I'm excited about is that other departments across the enterprise are also investing in equity and resources. So how do we partner better with them across the enterprise? So as we do that level of analysis over the next year, over the next couple of months, really, we'll definitely be planning in the 5-year forecast for any additional resources that we might need.
Thank you. I just would say I would be very interested to be kept updated on whether you are appropriately staffed for this extremely diverse and mighty set of endeavors that you've been charged with. And please, my colleague has said this a number of times to other individuals, but please definitely let us know if you're not, because we can't ask you to do work that you don't have the staff to do. So thank you.
Thank you. Thank you, Andrew. Good job.
Next up, we have the Director, Claudia Silva, for the presentation of the Office of Ethics, Compliance, and Labor Standards.
Good afternoon, Chair Fletcher and board members. I'm happy to present to you today the Office of Ethics, Compliance, and Labor Standards with its 2 divisions, the Office of Ethics and Okay. I will sit up a little taller. Okay. I'm happy to present on our office with its 2 divisions, the Office of Ethics and Compliance and the Office of Labor Standards and Enforcement. These 2 divisions both have strong education outreach components to their programs, with the Office of Ethics and Compliance, which we all affectionately refer to as OEC, being internal-facing for its employees, and OLSC, the Labor Standards and Enforcement Office, being external-facing to workers and businesses. I'll start with the overview of OEC and then discuss OLSC. The Office of Ethics and Compliance manages our ethics and compliance program, investigates and manages complaints, and implements and oversees the county's code of ethics. OEC investigates discrimination complaints in which a county employee alleges workplace discrimination, a client alleges they have been discriminated in the provision of county services, or a member of the public alleges they have been denied access to a program, service, or activity based on their disability. In addition, we investigate complaints alleging improper county government activity, which is commonly referred to as fraud, waste, and abuse, and includes abuse of authority for personal gain, gross mismanagement, significant waste of county funds, improper billings, conflicts of interest, patient and client privacy and safety, violations of federal and state funding requirements, and potential danger to public health and safety. We are also the county's ADA Title II coordinator, coordinating the county's compliance to the Americans with Disabilities Act, ensuring people with disabilities have equal access to program services and activities, and provide staff support to the Committee for Persons with Disabilities, as well as serve as the CAO's liaison to our County Employee Resource Group and chair our Diversity and Inclusion Executive Council. The Office of Labor Standards and Enforcement, established by your board in May of 2021 as a new county office, is developing into a central location for education and resources for workers and employers, undertaking research and data analysis about worker issues, and pursuing the enforcement of our county measures to protect workers. We emphasize education and outreach for workers and employers in matters related to workers' issues. We pursue compliance with county labor standards and regulations by receiving and investigating complaints and pursuing the enforcement of those requirements. And we undertake data-driven research and analysis to provide recommendations for advancing fair and safe workplaces. Our first annual report will be completed to you all this month. This past year, the Office of Ethics and Compliance has focused on increasing its visibility across the enterprise, increasing micro-trainings, and furthering the reach of our ethics and compliance program at the department level. I'd like to highlight some of our accomplishments in these areas. OEC developed the Ethics and Compliance Awareness Plan this year, which outlines its training, activities, and communication strategy over a 24-month period. The plan's focus areas align with areas of compliance risk and is designed to mitigate those risks and promote an ethical culture. A key part of the awareness plan is the monthly communication we call Know the Code. Know the Code is a multi-pronged communication approach that layers messaging through microlearning videos, written articles, emails, and other activities that create scalable, on-the-spot training at the group, department, division, unit, and individual levels. Know the Code was launched in September and is prominently featured on Insight every month. To further our reach to more employees, we launched the Ethics and Compliance Ambassadors Program in January. These ambassadors are a proven method to broaden the reach of our Ethics and Compliance program by cascading key messages to resonate with different audiences, which enhances compliance awareness at all levels. We have ambassadors across the enterprise, and their work has increased engagement with our Know the Code series. Our county's compliance committee has been involved in all these endeavors, providing input and insight. This committee this year has spent considerable time on implementing effective methods to reduce and monitor compliance risks based on our internal tracking and trending. Looking forward, tracking and trending complaint histories will continue to provide data to drive informed decisions of where to focus our training efforts. We know microlearnings are an effective strategy in providing trainings in bite-sized pieces, and layered messaging assists in retention. And our recently launched ambassador program will continue to mature as we strive to have every employee take ownership of promoting and maintaining our ethical culture. Since launching the Know the Code in September, we have been tracking its views and like to highlight some successes. The bar graph depicts the views of Know the Code with the green and orange, showing the corresponding views of the videos and articles. We see an overall increase in views corresponding to the launch of the Ambassador Program in January. And of note, during Ethics Awareness Month in March, we saw increased views of prior Know the Code videos through the work of the Ambassador's promotion. Those views are shown in yellow on that chart. We hosted Ethics Awareness Month activities virtually this past March, and I'm happy to report that employee engagement with our Ethics Awareness Month speaker series has exceeded our prior in-person speaker events. Overall, between live attendance and video views afterwards, there were just slightly under 1,500 views of the speaker series. Thank you all for making it such a success. In addition, since the launch of our Know the Code series in September, we've had 2,800 views through Ethics Awareness Month in March, and almost 3,100 views to date, or actually a bit more now, of the articles and videos combined. Since establishing the new Office of Labor Standards and Enforcement, we've been engaging in extensive outreach to our stakeholders. In addition to over 30 one-on-one meetings with various stakeholders, we've formed the Fair Workplace Collaborative, which includes 21 stakeholder groups shown on that chart. And we continue to engage and reach out to other groups and organizations. We have formed working groups to provide input and insight as we develop the Education Outreach Program, as well as the Enforcement Program. We've been working with our internal stakeholders, the various departments we'll talk about in a moment, external stakeholders, and governmental stakeholders as we work to implement the board's framework. We have also undertaken an environmental scan of other OLSCs throughout the country to understand the varied breadth of different OLSCs, the worker issues they are seeing, and how they are addressing them. And we are onboarding the OLSC team. Our significant first hire was to bring on our deputy director, who started in February and hit the ground running. We have 2 group program managers starting in the very near future, with our first one tomorrow. We are recruiting for administrative support and our compliance investigator. Some OLSC highlights. As looking forward, the work that we do is rooted in knowing the impact of wage theft. And we have received aggregated Department of Labor Standards and Enforcement, as well as Federal Department of Labor data that shows us over 20 years there have been about $119 million in wage theft, impacting 48,679 people in San Diego County. While these numbers include information from both state and federal agencies, as well as accrued interest for unpaid judgments, it tells us a very clear story. We have a large number of people impacted over the past 2 decades. We are in data gathering and analysis mode now and look forward to providing further additional information in our forthcoming report. Looking forward, we are working on the implementation and enforcement of the ordinances and resolution currently adopted by your board. We are working with the Department of Environmental Health and Quality, developing the implementation of the Good Faith Business Owners Program, and are working with Purchasing and Contracting, Public Works, General Services, Parks and Recreation to provide the education and enforcement of the Working Families Ordinance. And will soon launch our online training on that ordinance, which will be made available in multiple languages. We have been working with Planning and Development Services to develop the education and enforcement aspects of the recently adopted Subcontractor Transparency Ordinance, and look forward to including the data from that program in next year's annual report. and we've been working with Parks and Recreation in enforcing the electrical rigging safety requirements. We are working to further our reach into communities through direct engagement and are exploring a workers' rights business compliance clinic. Education and outreach is a critical component of labor standards and enforcement programs. We are working to implement a Know Your Rights, Know Your Obligations campaign so we can keep workers and employers apprised of all recent developments by your board and knowledgeable about workers' rights and employers' obligations generally. We are looking at the feasibility of creating a San Diego County Labor Standards app for workers and employers, and will be launching multilingual labor law compliance video training series for small businesses. A few of our key performance measures for our both of the divisions of the offices. As you can see, the Office of Ethics and Compliance is estimating 49 actual trainings, workshops, and presentations by the end of this fiscal year, which is a combination of presentations and trainings. Our estimated actuals this year are higher over our adopted number, as we had a big push on increasing our visibility and furthering our reach. Next year, we are anticipating at least 30. The Office of Labor Standards and Enforcement has thus far had 41 estimated community engagement meetings, which is high this year because we are ramping up the office and have focused quite extensively on our stakeholder engagement and outreach. Our community engagement includes those meetings and outreach with various stakeholder organizations and groups in the development and implementation of our programs, keeping engaged with our stakeholders about emerging or recurring issues, and keeping our communities apprised of OLSC's activities. Our education outreach line item is the direct engagement with workers and employers to raise awareness of their rights and obligations, and the training directed and tailored for workers and employers. We are undertaking some of the education outreach, such as what we are doing with the Working Families Ordinance and the Subcontractor Transparency Ordinance, as well as contracting with community organizations for direct engagement as trusted messengers with workers and small businesses. Overall, our expenditure summary has an increase for one additional FTE for the Office of Ethics and Compliance, which is to assist in the workplace investigations. The OEC team has been working tirelessly to raise ethics and compliance awareness, investigate complaints, and expand our program. Thus, we're seeking an additional FTE based on a sustained increase in our workload and complexity, particularly in the workplace investigations. In the Office of Labor Standards and Enforcement, the hiring our first deputy director has allowed us to make significant headway on multiple fronts, as I previously described. We've engaged with a wide range of stakeholders to inform and develop our programs and started the data analysis to identify those industries with the highest incidences of wage theft. For the upcoming fiscal year, we are seeking a $300,000 adjustment for consultant services to assist OLSC in its education outreach programs, which includes a labor standards advice line for both workers and employers so they can each understand their rights and obligations, to undertake direct engagement as trusted messengers, and to provide assistance to workers when they are faced with employers not abiding by labor standards. We are maintaining the number of FTEs in OLSC based on our current breadth of enforcement authority and the availability of data support from our Department of Performance Analytics Unit. The following shows how we are aligning with the county's strategic plan. The Office of Ethics and Compliance will be preparing annual reports of complaint history for each of the management groups, so there's awareness of the trends in complaint types and histories so appropriate mitigation can occur. These histories take a 3-year look at the complaints filed with our Office of Ethics and Compliance, cross-references them against industry benchmarks. In addition, OEC continually strives to implement best practices in achieving organizational excellence through promoting a culture of ethics, through our new microlearnings, conducting at least 30 trainings annually, as well as presentations and workshops throughout the year. Including ethics and training as part of the various leadership academies, as well as department meetings and professional conferences. The OLC aligns to our strategic plan in various areas. On sustainability, by providing annual reports on trends, gaps, and opportunities to increase worker protections from unscrupulous employers, based on data and the review of existing policies. OLC will provide the capability to respond and recover to the needs for individuals, families, and the region by implementing programs to encourage compliance by businesses with outstanding judgments for owed workers' wages. In regards to equity, OLSC aligns with equity by advancing opportunities for economic growth and development to all individuals and the community by implementing a hub for resource and referrals regarding labor standards applicable to workers and employers. It also ensures an equal playing field for businesses and workers by ensuring that our workers receive the full economic benefit for their labor through outreach, education, and enforcement of the Working Families Ordinance and Subcontractor Transparency Ordinance. The OLSC is dismantling barriers to expanding opportunities in traditionally underserved communities and businesses, especially communities of color and low income, by implementing a labor standards advice line for businesses and workers who need assistance with understanding their rights and obligations. Lastly, in regards to community, OLSC is creating proactive communication that is accessible and transparent. OLSC is developing easy-to-access information on labor standard requirements adopted by the county, which includes a multilingual outreach and education program that will provide educational materials in a variety of languages to reach impacted communities in the county. OLSC is inspiring civic engagement by developing community-based education and outreach programs on current initiatives, labor rights of workers, and labor law obligations of employers, and leading the Fair Workplace Collaborative, consisting of community-based organizations working with OLSC to provide input on the development of its programs and identifying community needs. This concludes the Office of Ethics, Compliance, and Labor Standards presentations, and I'm happy to answer any questions.
Thank you, Claudia, and I know great interest in watching the implementation of the Office of Labor Standards Enforcement as we go forward. Why don't we keep going? I'll see any requests for board members maybe at the end.
I'll now turn it over to the Director of Purchasing and Contracting, Jack Pellegrino.
Thank you, Claudia. Good afternoon, Chair Fletcher and members of the board. I'm pleased to present Department of Purchasing and Contracting's operational plan for the coming fiscal years. DPC's responsibility is to purchase all goods and services required to support county departments in support of their missions and service to county residents. Our vision and mission is to maintain excellence in procurement support with full engagement and collaboration with departments, business communities, and suppliers, while accomplishing all procurement actions with full transparency, fairness, and equity of access. Our notable accomplishments last fiscal year were that we competed over 90% of our dollars eligible for new awards, and approximately $1.6 billion of our annual spend was with local San Diego regional businesses. This amount represented 80% of our annual spending of approximately $2 billion being accomplished within the San Diego regional economy. We have focused our inclusive supplier and community engagement outreach efforts for small and minority contractors. Our results are highlighted in our fiscal 2020-21 Supplier Diversity and Community Engagement Report, which is available on our department webpage, which shows that 43.4% of our newly awarded contracts were awarded to small, nonprofit, and veteran businesses. Looking forward, DPC will continue our close partnership with the San Diego Small Business Development Center, who hosts training sessions for community-based organizations and new first-time contractors. SBDC offers free sessions for both live events as well as on-demand recorded videos covering contracting topics of how to successfully participate in county procurements. SBDC will also continue to offer free consulting support to new and small businesses interested in doing business with the county. Lastly, DPC will continue its engagement with the San Diego Economic Development Corporation as a co-chair of the Anchor Initiative Institution Collaborative effort. This initiative brings together San Diego's large buyers, community partners, and small businesses to maximize positive economic impact in the region through procurement, capital investment, and neighborhood infrastructure improvement. Details can be viewed at EDC's Anchor Institution Collaborative webpage, shown on the slide. DPC has established both internal and external performance measures to track our accomplishments. Our internal performance results for last fiscal year reflect our significant efforts in community and supplier outreach, hosting 19 events, mostly remotely offered through our partnership with SBDC. Events recommended for the coming years will continue to be strategically scheduled and focused to continue to improve equity of access and inclusion of minority and community-based contractors in our new procurements. We will continue to competitively procure our supplies and services, once again targeting 90% of our dollars awarded, as well as ensuring the depth of competition remains healthy of 50% of our solicitations achieving 3 or more bids for evaluation. DPC's internal performance metrics reflect our continued timely and efficient delivery of procurement services to our department customers, significantly meeting or exceeding our timeliness goals, achieving 75% of our RFPs completed within 180 days, and amendments completed within 30 days of initiation. And lastly, confirming that all departments have current retention schedules. As part of our internal service fund request, we are proposing to add 6 full-time equivalent staff to increase our staffing resources to accommodate increased procurement workloads across the enterprise. These additional resources will also continue to support increased community and supplier engagement. Costs for these additional staff are included in our proposed FY 22-23 internal service fund procurement rates. DPC's go-forward initiatives and plans align to the county's strategic plan in these 4 areas. First, sustainability. We will continue to provide departments guidance and best practices for reutilization of county surplus property and provide assistance in defining and including sustainability requirements in our future procurements. Equity. We will continue to expand and increase our small and diverse community and supplier engagement, including appropriate contract performance requirements that require community subcontracting and hiring. Empowerment. We have initiated our upgrade of our BINET procurement system to improve access and ease of use for all contractors and the community. Lastly, community. DPC will continue to host and participate in diverse outreach and engagement events and conferences encouraging community, minority, and small contractor participation, as well as continue to work closely with the Small Business Development Center and the regional EDC. Subject to any of your questions, that concludes my comments.
Thank you. Supervisor Lawson-Remer.
Thank you so much. It's very helpful. Just had a couple of questions about the Small Business Assistance Program for the grant application. So wanted to better understand exactly what that technical assistance consists of.
So Supervisor, with the SBDC, we help them develop a curriculum so all businesses can understand how to respond to our requirements, what they need to do to be successful in our requirements, and then after those classes, they are available to do one-on-one consultation with the individual businesses if they respond to solicitation.
So it's basically like training and then kind of one-on-one coaching.
Correct.
Not actually sort of doing the work to help folks fill out the forms, but more coaching and supporting them to do it themselves.
Potentially. I mean, they're in a position, if there is someone that wants to respond to a solicitation, they can help show them how to respond. Mm-hmm. They obviously can't do it for them, but they can coach them, and they do that free of charge.
And what's our definition of small businesses that qualify for this? I mean, because just throughout, we talked a lot about small businesses, so what does that mean?
We follow the state of California small business requirements, which is as far as $15 million over 3 years, or they're certified as a small business through the state of California. Also, though, there's many nonprofit organizations that would qualify and often seek services from the small business. They offer them as well.
So $15 million in revenue
over 3 years.
Over 3 years, or for the nonprofits, what's the qualifier?
There really isn't a nonprofit. I mean, they follow the same standards, but I have, to the best of my knowledge, they haven't denied any nonprofit that came to them and asked them for support. Most larger small nonprofits don't seek that assistance, but the smaller ones can surely avail themselves of that.
Thank you. Appreciate it.
Thank you, Jack.
Now I'd like to pass it over to our Director of General Services, Marco Medved.
Thanks, Jack. Chair Fletcher, members of the board. Good afternoon. The Department of General Services is an internal service department and ensures that other county departments have the tools necessary and the workspaces and services and vehicles to accomplish their own business objectives in serving the public. These services range from real estate leasing and acquisition support to architectural planning and capital improvements, from facility and maintenance and repairs to security management, and from vehicle acquisition to maintenance and refueling of vehicles. We had a productive year last year and this current year, completing several significant projects, including the Youth Transition Campus Phase 1, which reflects national best practices in promoting positive youth development and staff well-being. In support of the behavioral health continuum of care, we recently completed the North Coastal Crisis Stabilization Unit in Oceanside, completed design on the Tri-City Psychiatric Health Facility, and are in design for a psychiatric unit within Edgemoor Skilled Nursing Facility. We're also commencing design in another CSU in El Cajon. For County Fire, we completed construction on new living quarters at the Palomar Mountain Station number 79 and a new station on top of Mount Laguna. We're also completing design on a new station in East Otay Mesa, which will have a minimal carbon footprint. Construction continues on southeastern Livewell Center. Structure recently topped out with steel this past week. Steel was set by a local disabled veteran small business, and the contracting includes many local businesses. We expect to open a colorful and spacious new Lakeside Library to the public in early October. We continue in year 3 of 5 in renovating this historic county administration center, focusing this year on the exterior. You can see the scaffolding going up as you're coming and going from work. In support of sustainability, all our facilities that are capable will be designed to zero net energy standards and meet LEED standards to reduce our county's carbon footprint. Forwarding our EV roadmap, we just completed installation of 19 public and 119 fleet charging ports. And this year, I plan to install electric vehicle chargers for both public and fleet vehicles at 9 county facilities. We also supported your board's decision for the unincorporated county of San Diego to join the San Diego Community Power, a local community choice energy joint powers authority, while also saving $2.5 million in energy purchases through our direct access program. The capital improvement program proposed for 22-3 includes 14 projects approved on SENA in March and an additional 6 projects approved in May, in addition to the major maintenance capital outlay fund. Sustainability is woven into all our new capital delivery projects, highlighting our commitment to protecting and promoting the county's natural resources, furthering our electric vehicle roadmap, and increasing our inventory of zero net energy facilities. We'll focus on reducing disparities and increasing the equity of access to health and social service delivery systems by rebuilding our public health system, improving access to food, and furthering the behavioral health continuum of care. In support of community, we'll continue to improve the county's fire protection district, shorten response times for our public safety providers, and provide recreational programs to our underserved communities. As stewards of our existing infrastructure, we'll increase the lifespan and utility of our existing facilities in support of programs designed to increase the well-being of our citizens. And finally, we'll make meaningful enhancements across our justice facilities and improve existing systems to meet current standards in health, safety, and accessibility. 2 of our key metrics drive our sustainability posture. Energy use intensity, or EUI, is calculated by taking the total energy consumed per square foot of facilities so it can adjust to our footprint. Our EUI decreased by 14.5% for FY 2021 and has decreased 30% since we started measuring in 2014. It's driven largely by construction of new highly energy efficient buildings, completing energy efficiency and commissioning projects on our existing buildings, a heavy focus on teleworking, and lower usage during the pandemic. Our GHG, or greenhouse gases, decreased by 5% in the last measured period and 7% since '08. Data on greenhouse gas emissions is tracked annually by calendar year via an international protocol. Drivers for this significant reduction are the EUI factors from facilities I just mentioned, continued growth of renewables at county facilities, which currently provide 20% of our total load, reduced fleet emissions due to acquisition of more efficient vehicles or electric vehicles, and lower landfill emissions. The general fund contribution to general services represents just over 1% of our internal service budget and is primarily used for development of the capital and major maintenance programs. DGS operations serve our client departments through an internal service fund structure via nearly 400 personnel. Our department held staffing flat for the last 3 consecutive years, and this year is requesting an additional 32 FTEs, including 29 in facilities management and 3 in fleet management. 1 new position is unclassified. 5 positions will support the sustainability initiative in combating climate change through support to the electric vehicle roadmap, a zero waste program, and a zero carbon plan. 8 positions align with the equity initiative and will provide dedicated support to the San Diego Psychiatric Hospital, Edgemoor Skilled Nursing Facility, and the Office of Homeless Solutions. 7 positions support the Empower initiative and will increase our commitment and investment in our workforce and enhance client support for growing programs. And lastly, 12 positions align with the community initiative and will provide dedicated support for projects and maintenance related to affordable housing and public health services. In support of our strategic plan, we will integrate our county fleet and facility efforts with the regional decarbonization plan. We will also develop a water conservation plan for county operations in response to the current and future drought challenges. In equity, we will continue to develop new affordable housing projects on county land. And we'll also continue to support HHSA in the establishment of solutions for persons experiencing homelessness, including the Lucky Duck shelter at Rosecrans in the near future. In Empower, we will support footprint reduction, and general services will coordinate with departments to consolidate, reduce, and collaborate on space and vehicle requirements. In community, we'll complete 2 new community facilities in construction this year and this summer, including the San Diego County Fire Training Center in Rancho San Diego and our last Zero Net Energy facility, or our most recent in the Lakeside Library. And finally, in support of the Justice Initiative, we'll commence Phase 2 of Youth Transition Campus, renovate major systems of the Hall of Justice and George Bailey Detention Facility, and open the North County Family Justice Center. And this concludes my piece of the presentation, subject to your questions.
Thank you, Marco. Let me see, I'm not seeing any questions. Let me ask Clerk if we have any public speakers in this item.
Thank you, Chair Fletcher. We have 1 request by phone. I believe they've already called into the conference line. I'd like to remind the caller that they should mute their TV or live video stream before they begin speaking. Andrew?
Thank you. We'll begin with the caller.
Truth. For finance and general government, there's now a $22.4 million increase in spending, mostly for salaries and benefits. It says there's supposed to be a, quote, strengthening of the customer service culture by ensuring every customer has a positive experience, end quote. Well, many members of the public have had very negative experiences commenting at these meetings. I was quite disgusted myself with the last one, Nathan. Maybe if the 2.00 staff years were decreased for each supervisor, people would feel more listened to. Just a little joke. In the public communications attachment, there were great points made by Mr. Paul Henkin, as usual. He mentioned the decline in population in San Diego County, which will inevitably result in a decline in tax revenue. But that decline doesn't seem to stop you supervisors from maintaining an inflated spending amount of $7+ billion. All those COVID checks the last 2 years phasing out, plus the decreased tax base, and yet the budget for next year has barely decreased. That doesn't seem to make financial sense. For DEI, Belonging and Equity 2.0, also known as targeted universalism, is setting universal goals for all groups concerned. Well, who decided the goals? I do know the whole program came straight from extremist UC Berkeley, and all they want is transformative change, just like the World Economic Forum. An example UC Berkeley provides is, instead of helping Black American students in school to score higher for college, they recommend lowering the bar on admission standards. That's actually pretty offensively racist to suggest that certain people don't have the ability to rise above academically, and very reminiscent of a communist society where everyone is brought down to the lowest level set. Certainly, ethics and compliance has a long way to go among the county programs of bias committee.
That concludes public comment. Chair Fletcher.
All right, thank you. Thank you to everyone for joining us for our budget hearing today. We will reconvene at 9 a.m. tomorrow morning for Land Use and Environment Group. With that, we stand adjourned.
Slowly, and we'll speed up for our second set, adding a little more power to our routine.